We are live now.
Good evening. Call to order a public hearing on the proposed annual budget for the town of Normal fiscal year 2021-2022. Please call the roll.
Mayor Kus,
Here.
Mr. McCarthy,
Here.
Ms. Cummings,
Here.
Mr. Nord,
Here.
Ms. Smith,
Here.
Mrs. Lorenz,
Here.
Mr. Preston,
The governor has issued a disaster declaration related to the public health concerns caused by the statewide COVID-19 pandemic. As mayor, I've determined that an in-person meeting is not practical or prudent because of the risk of exposure to the COVID-19 virus stemming from an indoor gathering, and that a remote meeting is in the best interest of the health, safety, and welfare of the council, staff, and general public. Is there anyone here tonight wishing to speak to a proposed annual budget for the town of Normal fiscal year 2021-2022? Is there anyone here wishing to speak to the proposed annual budget for the town of Normal fiscal year 2021-2022? And third and final time, is there anyone here wishing to speak to the public hearing on the proposed annual budget for the town of Normal fiscal year 2021-2022? Motion for adjournment, please.
So moved.
Second.
Please call the roll.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
Aye.
Ms. Smith,
Here.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mayor Kus.
Aye, the public hearing is adjourned. Call to order a meeting for the Normal Town Council for Monday, March 1st, 2021. Please call the roll.
Mayor Kus,
Here.
Mr. McCarthy,
Here.
Ms. Cummings,
Here.
Mr. Nord,
Here.
Ms. Smith,
Here.
Mrs. Lorenz,
Here.
Mr. Preston.
Here.
We'll begin with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Again, the governor has issued a disaster declaration related to the public health concerns caused by the statewide COVID-19 pandemic. As mayor, I've determined that an in-person mayor is not practical or prudent because of the risk of exposure to the COVID-19 virus stemming from an indoor gathering, and that the remote meeting is in the best interest of the health, safety, and welfare of the council, staff, and general public. We have no public commenters tonight. I'm going to ask to amend the agenda or rearrange the agenda to take the item of new business, a presentation by the McLean County on mental health action plan. Unless there's an objection, I would like to take that first. And hearing no such objection, we will.
I've got a question, Mayor. I've got a question or a comment. I can't find the raise hand button on this. There it is. All right, there, hands up, sorry.
Go ahead, Mr. Nord.
Okay, thank you. I think this is a great idea that we move the commenters to the beginning of the meeting. And I would also like to recommend that we give the same consideration to the public, because some of the public may have to talk at the end of the council meeting. So I think it's a great idea, and I'd like to extend it and offer it out to the public as well.
I'll poll the council and see what their opinion on that is. The item of new business is a presentation by McLean County on the mental health action plan. Joining us are County Administrator Camille Rodriguez and County Board Chairman John McIntyre. And Pam, do you have any initial comments or?
Thank you, Mayor. I just would like to
extend a welcome to Chairman McIntyre and County Administrator Ms. Rodriguez. And they had volunteered to come speak with you to give you an update on the mental health initiative and the mental health action plan. And coincidentally, council brought this up during our budget work session as well. So the timing is good. And so thank you to both of our county representatives for joining us. And I'm going to turn it over to Ms. Rodriguez.
Thank you, City Manager of the Town of Normal, Ms. Reese. I appreciate the invitation that you've extended to Chairman McIntyre and I. Thank you, Mayor, and thank you, Council, for having us. I am really going to start by turning it over to Chairman McIntyre to discuss the mental health action plan and begin discussing the initiatives. I might tie a bow on it on the end, but I turn it over at this time to Chairman McIntyre. Thank you.
Hey, thanks, Camille, and good evening, everyone. Thanks for having us. Let me give you a little bit of a background on this. Some of you I know were involved as the original plan and some of the meetings. Back in the year 2014, our current sheriff at that time, Mike Emery, came to our county justice committee with some problems that he was having with the jail, not only overcrowdedness, but supervision of intake of new inmates in the jail, because they had to continually watch them because of behavioral acting out and behavioral illness symptoms. And concurrent with that, at the same time, our finance committee was dealing with an issue of the jail being very overcrowded. In fact, the county was having to send inmates to other counties and pay up to a total of over $750,000 a year. And so that was both something that needed to be addressed. The sheriff and the justice committee got the National Institute of Corrections evaluation team to come in and spend time with us and write a report and give suggestions as consultants. As part of that report, it was pointed out that it might be a good idea to study the whole community, because some of the problems we were having was a large percentage of the population of inmates in the jail suffering from behavioral and mental illness types of things. As it turned out later, that has become a national problem, as most of you might know. We began having our meetings then a lot of times over at the Law and Justice Center, and our county chairman at the time asked me as vice chairman to form some advisory groups. And so we reached out to the community, and we formed 2 advisory groups and brought in anybody that was affiliated with our healthcare system, with counseling services. And we had over 75 people that participated in these meetings. Similar to what you would say were like hearings. We had them here for monthly meetings back during the part of the year in 2015. The two groups that met, one of them was to establish the needs, the mental health needs in the county, and the other was to reach out to other counties and places in the country and establish some kind of best practice system. And we did have speakers come in from outside our own county. When that was finished, it was determined that we felt like we needed to initiate and write a plan. And so at that time, the needs committee identified 5 or 6 what we thought were basic needs confronting our whole county and the residents of our county. And then the other one was then something to do about it, a course of action. So our mental health action plan was actually written by a number of subgroups of people that had participated from our community of the 70 people. And so in 2015, we wrote this plan. I don't know if you can see it. If you cannot see it and you'd like to see copies of it, you can check the county website, and there's a link there, and you can access the whole plan and go through that. I know a few of you are probably involved with that at one time or another as we went through the plan. When we wrote the plan, then we started to address, first of all, the needs and develop some objectives that we thought needed to be addressed. with the community. And we developed long-term and short-term objectives. Some of the needs that were identified as a problem in the community, one was crisis response. And so we worked with PATH and with the mobile crisis team and others to establish some possibilities on how we could help that. At that same time, I attended with a small group of people, including a couple of judges and people that had participated on the One Voice trip to Economic Development Council, sponsored every year, and presented to the Bureau of Justice Assistance in Washington, D.C. our mental health plan, which was very well accepted on a national level, which resulted in us getting a crisis intervention training grant, CIT, and we were able then to train all our first responders in the county, throughout the county and the community, on what to do if they came upon a scene and encountered someone who was displaying types of symptoms or behavioral symptoms that might be related to mental illness, and how to handle that. I think that training for all of our responders has paid off throughout these last few years, as you can see some of the problems that have resulted nationwide that we've been made aware of, situations that mounted. Our plan was at that time to later on try to develop an information system that could be obtained through the police officers, even their squad cars, very similar to where if they could, nowadays they can pull up a person's driving records when they come up on the scene of a stop, very similar to that if they were called out in a situation. We've been working to try to help get that developed, and we can talk about that a little later on. So we did get the crisis plan going. In our mental health action plan, we also identified housing as a need. And so we've continued to work with housing and for the homeless situation, and developed a plan called Frequent Utilizer Systems Engagement System, which came out of the Center for Supportive Housing nationally, which actually we were exposed to when we had a speaker come to our annual forum, our first annual forum. And our first annual forum was part of our plan as one of our objectives to raise the level of awareness to people in the community about mental health and to help eliminate some of the stigma that's involved with people who suffer from mental health. And so we've continued to have that forum, and you can also access that forum. Of course, this year had to be virtual, online through our Behavioral Health Coordinating Council. Another need that we identified was for better collaboration and coordination between all of our agencies that provided services. And we have worked to continue to do that. And one way we've done that was develop the Behavioral Health Coordinating Council. And the Coordinating Council is made up of leaders and representatives from different organizations within the community throughout our healthcare and governmental system. Member McCarthy is a representative for your council on our BHCC, our Behavioral Health Coordinating Council. Another need, obviously, that was adopted and identified was the overcrowdedness in the jail. And not only the overcrowdedness in the jail, but also the fact that we needed to have a way to deal with all those inmates that we had who were suffering from mental illness symptoms. And it was very difficult that you almost had to supervise them, as the sheriff would tell you, all the time. Otherwise, there was ransacked jail cells, they were injuring themselves, etc. And the way that was done was us to develop, which is a very exemplary type of a jail edition, which you see when you go by, designed in pods so that many of those types of inmates can be observed continually without tying up people in booking or in a linear jail type of a system where they have to be continually watched one-on-one with personnel. So we designed that. We sent out a team around the country from our property committee and came back and helped design and work with that. And also at the same time, we wanted to design it so that it was better facilities for female inmates. And so we did it at the same time. In order to get the money for that, at that same time, both councils, your council and city council, was taking a look at comps around neighboring counties about the sales tax and seeing a need to raise the sales tax 1 penny. And so this kind of become as part of our extension of our mental health action plan. We went out, myself and a few others, and met with the people on the council. And basically, we said we would like to follow through with this mental health action plan. And in order to do that, we need to build our jail, and we need to have some money to help initiate new initiatives in mental health that we identified as need. And the other one, besides crisis and homelessness and housing, was practitioners and youth services. And so at that time, I made the comment, let's develop this Behavioral Health Coordinating Council as an advisory group, which we have and we've continued to have, to advise us on what to do with this. So we were very fortunate through your cooperation to get 1/4 of that 1 cent, in which we then signed an agreement with you for 20 years, in which 1/4 of that cent, 1/4 of that 1/4 of that cent goes for helping us build a jail and the debt service on the jail, and also to develop a mental health action plan, and also to develop an information system, expand our information system, which we needed for our court services and our health system and many other things, which we can talk about a little later. So we have our Behavioral Health Coordinating Council. We developed our annual forum. We developed an advisory committee for our health department on mental health, which is separate from that one, a mental health advisory committee. And we created a number of other initiatives that we thought would help with our whole situation. I made the comment at the time, we've put in a lot of time and effort on this plan. We wrote it, we're gonna follow through with it. We're not gonna throw it on the shelf as a study. It's gonna be more than a study, it's gonna be an action item. And so that's what we have done. As a result of that, we developed a comprehensive assessment team called a CAT team of high-risk students. We've developed the triage system. We sent a group to Chicago to visit their Southside Triage Center and developed a triage system. And the triage system, I can explain very briefly, is whenever police officers and EMS pick up someone, they've always had to take them to ER, emergency rooms, and stay with them. And they had to be with them until they were diagnosed or released, once they were in their custody, whether or not they had a criminal part to it or they were in their custody. So that tied up police officers sometimes sitting around emergency rooms for 5 and 6 hours or more. So we thought at the time we could develop a plan that could help them, and they could bring them to our triage center if it was thought that they didn't need to have medical attention right away, and maybe they were displaying and acting out, and the triage center then could determine where they needed to go. Another thing that was developed at that time was a crisis stabilization unit, which has been developed ever since and up and running out of Chestnut Health Services. And so that was another place where we could then refer people who were suffering with these types of behavioral illnesses or even addiction out to Chestnut. And so we were able to get a grant from the state on that. At the time, Governor Quinn came and developed that area out there. Some of you might have been there. And so that's still up and running as part of what we did with this plan. Besides that, the FUSE program, Frequent Utilizer Systems Engagement Program, came out of 3 or 4 of us attending the White House workshops on data-driven justice initiative, and when President Obama was addressing that on a national level. And the FUSE program, acronym for Frequent Utilizer Systems Engagement, was to identify those people out on the streets who were the frequent utilizers of the ER and the health system and in jail, and to get rid of this recidivism where they're getting released from the jail, end up back in medical conditions, and the money that was costing on an average of what at that time was termed a frequent flyer, later was called a super utilizer of our healthcare and our court system. The national study showed it was costing a county $300,000 on an average a year. just to deal with these types of people who are having these problems. So our FUSE plan is located, and our FUSE department is located in our health department building, along with our triage center, in which we can help those types of people with what's called wraparound services, which means we're giving them intense counseling. We're working with with Bloomington Housing Authority to get vouchers for them a place to stay, and also, try to keep them off the streets that way. So this has helped. As we just got this up and running, we hired a behavioral health coordinating supervisor, Ms. Trish Malott, to get this started. And we just barely got into it, and we're doing pretty well. And then COVID hit, and it became more difficult, and it's kind of stalled part of our program. The one thing that we have not been able to do to follow through with this has been our youth program. And so we've worked to develop that youth program and work with it. Some things have come out of it through our health department and through our regional office of education, and that is embedded counselors in our schools. And to explain the term embedded counselors, it means another counselor in the school system, especially in the secondary level right now, that has been involved with working primarily with just situations with students who are identified at risk and need to have specific help one-on-one and referral training there, more so than what some of the other counseling staffs can do. And so we have some of those programs started out through our health department and through our regional office of education. We need to follow through with this and maybe even develop more of that type of a program. We've run into a few roadblocks with our youth psychiatric outpatient type of system that we wanted. And that's part of that. It was collaboration, and part of it was just getting, and I'll turn this over to Ms. Rodriguez to talk about our RFP a little bit and where we are with there. I'm trying to bring you up to date on where we are with this plan. Ms. Rodriguez, would you like to address that for a minute?
Absolutely. Thank you, Chairman. I'll be brief. I know the council has so much work to do tonight, I understand. So we did release an RFP several months ago, and the intention was, after a collaboration from some BHCC members as well as other social service agency staff, those groups decided that one of the best ways to fulfill needs of youth in this community might be to create sort of a drop-in youth center for young people who are either being discharged from a hospital situation dealing with a psychiatric issue, or even to prevent hospitalization for psychiatric reasons. Sort of, again, a wraparound service concept, access to resources, individualized treatment plans with care coordination. This request for proposals was well thought out. It was written with the co-sign of all of those involved. And yet at the end of the day, there were no responses to the RFP. And I know the chairman and the Behavioral Health Coordinating Council really believe in our focus on what youth in our community need. We feel for the families, for example, that also have youth perhaps in inpatient treatment that discharge and need those extra services. We have not lost on this idea and on this focus, but at the time and place there were just no responses. And then, as many of us realize, the pandemic slowed down a lot of such planning, but it didn't change the landscape of the needs. And some of those needs do include something that transcends all age groups, and that is access to psychiatry. And that's a whole another realm of what has been part of the mental health action plan. But in essence, we don't see this as something that is not going to be addressed. We do plan to roll up our sleeves and regroup because our youth and their mental health is obviously just as important as any other group that has already had programs stood up through this amazing mental health action plan. So we're going to regroup. and work on that again. But that's a quick summary of what we've done so far in that regard for that request for proposals.
I know you've got a long meeting and a lot to do. I just want to tell you, the other need to be addressed was lack of practitioners, psychiatrists within the community. Again, we discovered obviously that that's a very severe national need and trying to get people involved. We did do some lobbying with legislators, and we did at least get to the point where there are people that can prescribe medications who are DPNs and so on. As you've noticed that if you've gone to the doctor's office, more people that are able to fulfill that role. We needed that because our counseling services who have to make use of psychiatrists or, just really need that kind of help. So we haven't been able to do that. Neither have they on a national level. We need to find a solution for that. So let me stop there and see if there are any questions of anyone that we can answer that you would like to have.
Are there any questions from council? Ms. Smith?
Yes. Have these actions resulted in any objective reductions in and diverting people into treatment instead of having them be criminalizing either their mental health issues or homelessness?
Yes, and if I should have addressed this a little bit, Karen, if you will look online and also check our executive committee reports, our Behavioral Health Coordinating Council reports to our executive committee on the county each month. And there is a Behavioral Health Coordinating website, and it has a newsletter, and it also has some results of where we are with our Fuse project and triage, and you can access those. Member McCarthy has graciously attended all of our meetings since we've originated BHCC, and he probably has access he could provide for your council.
And then a question and follow up to your information that additional counseling officers or individuals were assigned to the school system. Has there been any discussion of that personnel replacing the police resource officers?
Well, obviously that role it really is fulfilled much differently. We're talking about counselors who are working in the individual counseling sessions. Resource officers are not trained for that. Having been involved with our own in this community in public schools for years, I can tell you there is a definite need for resource officers, but we also have a definite need for our counselors who can really target at-risk students and work with and help them in a counseling role. So that's a different situation.
And one final follow-up. I'm familiar with the fact that the at least the Normal Police Department encourages families with individuals that have mental health issues or other concerns that might need a responding officer to be aware of that. Is that being heavily promoted so that families understand that this is an opportunity for them to ensure that a family member in crisis receives the proper response to a 911 call?
That's an interesting thing to address, because we right now, after 5 years, are in the process of going back through our plan. And I'll be meeting Friday with Mrs. Schaefer, chairman of our health committee, who also was one of the authors of the plan. And we're going to go through it and evaluate and revise it. So I will definitely take that into advisement and talk to our police departments about that as well, because we do have their input.
Thank you.
You're welcome.
Ms. Lorenz?
Thank you. Yeah, thanks. Thank you to Camille Rodriguez and Chairman McIntyre for coming tonight. If I understand correctly, so a quarter of the 1 cent sales tax is directed to the facility of the jail expansion and the, perhaps even the IT that goes along
Mhm.
with it. So I'm inferring from your other descriptions that the other 3/4 is going towards the triage center, the FUSE program, and then what's to be youth programming. Is that a fair statement?
Let me break it down for you a little more than that.
Okay.
Your council has a copy of our intergovernmental agreement, but basically, it's 25% of that is to help with the operation and the maintenance of the jail and the health services and mental health treatment within that. Another 25% of that was for the debt service and helping us to build the jail, which services the whole, communities and counties. The other half of that was for mental health and behavioral health services. Now that half has two parts to it. And one part was what we were doing with our Behavioral Health Coordinating Council and what our mental health supervisor does in establishing these initiatives that we identified with our plan. The other half of that is integrated case management, which is basically our electronic justice information system. When this was all presented originally and agreed by the councils, our electronic AEGIS system, as the acronym is, helps provide court systems all kinds of coverage and need, and was established originally in 1995. And we have our own basically system, and we tried to expand it and update it. Anybody that knows much about that, it was originally helped us be built in 1995 with the help of State Farm and their consultants. And over the years, we've had an exemplary system known throughout the country. However, it's 25 years old.
Mhm.
And so we knew that we were going to have to take a look at that and update it. And let me just give you one example of that system. It does all the types of things for all the police and their information system throughout, and our court system. The state of Illinois now has changed our circuit court e-filing system, and so now we're going to have to update that. We have a committee working on this plan. We originally thought that when we signed an agreement with you, that it would actually take $13 or $14 million over a 20-year period to upgrade this. It's going to be much more than this. And so we're addressing this. So we've had money available from the sales tax that we are dedicating for this. And the first part we are doing is working with our circuit court records system. And so our committee is working on that and dedicating now those funds for that. So that's part of what we're doing with that. That's the other fourth.
Okay.
There is a pie chart for that we presented to your council. Ms. Lorenz, your first meeting.
I think it was. It goes back pretty far.
Mr. Sorensen, or Mr. Lawson and I came, and we can get that to you if you want. I could show you basically, I ran across a copy of it that tells about our community initiatives and all right here.
Okay.
But, that breaks it down into what we're doing with it.
I think it's a
And I'll
good,
be happy to share that with you if you'd like, or we
Yeah.
can send it to you.
I think this is a great refresher, and you're right. I mean, it's been a while ago since we probably first saw a lot of those initial documents. I guess I'll just wrap up my time here of my comment by saying that, and I see that Mr. McCarthy has, is eager to speak as well. I think we need to hear, we as the council need to hear more frequently, or put a mechanism in place whereby we hear regularly and we see regularly what's flowing through the Behavioral Health Coordinating Council. To my knowledge, we don't have a rigorous way of doing that. And I would like to suggest that we put something in place for that.
Our Behavioral Health Coordinating Council meetings are public meetings, and I would suggest we could help with that by including or sending our minutes of our meetings or any materials that are distributed with Mr. McCarthy, if that would help you.
That would certainly be
like an annual report, we could file something with you that you could.
Right. Something along those lines, because it sounds like there's a lot flowing through that body, and this whole investment is really centered around that coordinating council. And I think for us to stay, my own opinion is for me to stay up to date with this investment. It sounds like that's where we really need to be receiving information from. So,
I agree with you. We can do that. And this council involves CEOs from both hospitals and a number of other organizations, obviously, that are involved in what we're doing. So that's a good idea, I think. Maybe you have a better idea what you can see.
Mr. McCarthy.
Thanks, Mayor. Thanks, Chairman McIntyre, Ms. Rodriguez, for coming and reporting out to us. And I'd like to echo some kind of an annual visit from you folks on what's going on. And for my fellow council members, to be honest, most of the time in those meetings, I'm listening to acronyms and professional information on mental health services that I have no earthly idea about. I'm there trying to listen to the funding and where it's going, which is what my role is, not as to understand all of the mental health services. But having said that, I don't have any process questions. Obviously, I'm at every meeting, so I know what's going on that side. But if you guys wouldn't mind, I know that you addressed or have worked on a couple of things that I didn't hear you mention, or maybe I missed them in your presentation. You mentioned the dearth of psych services here, and I know there was TELUS Psychiatry initiative that you guys worked on to try to expand services when you couldn't get practitioners to come to our community. You tried to figure it out in another way. And then maybe you also want to comment a little bit. You guys have been very successful at going out and getting matching grants to bring out more outside, leveraging the funds that we in the city of Bloomington and your boards have provided to go out and bring even more money back for these programs. Maybe you can speak a little to those two initiatives.
Thank you. I skipped right over Telepsych on my notes, and it's something I know Ms. Rodriguez, having been former director of our health department as well, can probably address, but that was the means that had to be used. We just didn't have any other way of providing the counseling, and not only in the jail, but elsewhere, with our court system, our recovery court, our drug court, and so on. So those types of things have been used, and sometimes with the help of Chestnut Health Services and with Community Health Service. Ms. Rodriguez, would you want to talk about that at all?
I'd be happy to. Thank you, Chairman, and thank you for your question, Mr. McCarthy. I think it's very important to note that even before I became the county administrator, when I was at the health department, I was working with then Administrator Wasson and the chairman on obtaining contracts with telepsychiatry services. It was cutting edge at the time. Many members of the county board and just partners said, what? Do psychiatry over Zoom? That just doesn't seem possible. And it's almost ironic. Look where we are now. We all interact that way because of the pandemic. But more specific to your question, not unlike most of the country, even though we entered into a contract with a vendor, we were highly unsuccessful in obtaining the services of a psychiatrist in this community to work with us. Not because we were not a desirable place to work, not because there was not an identified need, but because it was so highly competitive. We would get through interview after interview, and then we couldn't compete with perhaps a location that a psychiatrist would want to work. And we touted our wonderfulness here. Believe you me, we did. What we ended up with, it was not a consolation prize in any way, shape, or form, but we do have a nurse practitioner at the doctorate level who now works in between our FUSE program, as the chairman noted, called it Frequent User Systems Engagement, the FUSE program, as well as inside the detention facility where the people that live with us there need our psychiatric services, counseling services, and those referrals. And so that individual actually works in between both programs. And so while we have not stood up a telepsychiatry unit as we had intended. It is only because we could not find the practitioners to do it. And so instead, we shifted our focus and tried to problem solve in this way. And then so far, even in our health committee reports, Mr. McCarthy and to the total council, our jail medical staff report on the number of contacts that the individuals that live with us have had with services related to their needs relative to behavioral health. And that is one of the ways that we are addressing that particular issue. And then outside of the facility, of course, in the FUSE program, we're utilizing that individual there as well.
Yeah, I don't know, Mr. McCarthy, if you remember, but as chairman of the Behavioral Health Coordinating Council, I formed a committee to specifically work on that need for practitioners. And we even tried to offer paying for somebody's schooling if they would dedicate and sign a contract for 5 years of service with us. And we were trying to figure out how we could come up with that. Couldn't get any takers. We thought we had one once, but it's just very difficult. It's such a need.
Yeah, I think it's important that our council hears that from you folks, so that when we vote and start handing out money, we on some level expect a bunch of stuff to kind of just line up and start happening, and it doesn't work that way in mental health services, particularly in psych services. The provision of that is so difficult to find, not only people to come here, but even people to get on a screen and deliver those services to us from remote locations. So it's good to hear that. Mr. McIntyre, did you want to talk about any of the matching grant programs or that you guys have been able to leverage using the local dollars to bring back federal dollars for FUSE and beds and all of that? You're muted, Mr.
I hope, Mr. McCarthy, and all that I'm referencing the right things. The history that I have here is short, and it's been rapid to learn everything. I will say quickly, we have leveraged our relationship with the criminal justice system, most definitely. And so one notable issue that we wanted to address was the intersect and the relationship that needed to occur, in our opinion, with the Criminal Justice Coordinating Council and the Behavioral Health Coordinating Council, for one. And in that sense, it's not completely addressing your question, but it lays the foundation. So during my tenure, we have made it part of with the agreement of all CJCC members, the Criminal Justice Coordinating Council, to integrate a report during their committee meetings from the BHCC. And we think that's important because of the value of understanding why recidivism occurs in McLean County and what are the underlying issues that perhaps maybe even just staff in the FUSE program need to be aware of, so that they are working hard to keep people out of our detention facility, out of the criminal justice system. And one of the members asked a question. I have some specifics. In fact, of the FUSE members that have been involved since the start of the program, we tracked their prior justice contacts, right? So really briefly, and I'm really bad at math adding all together, but one person in particular had 12 justice contacts prior to their involvement in the FUSE program. And since the FUSE program involvement, those have been cut in half. Okay, and so that's one success and outcome example. But other matching grants or grants that we've obtained that intersect with this, there is what we call a CAT team, and so the criminal justice folks across the street, I always say, from the government center, have done well to get a grant to do wraparound services in that regard. And I could probably go on forever, but I will not cite incorrect grants because I have so many in my head from being the county administrator, but certainly I could provide a more comprehensive written report to the council and give to Ms. Reese so that I could cite to you all of the efforts that have been made. I will even say this, just to prepare for effectuating these programs that are inside the mental health action plan and that intersect with your generous contribution of the sales tax dollars. We worked with SAMHSA a lot as well. And we were sent out, several of us, on best practice implementation teams, and we intersected with great big places like Harris County, Texas, which is home of Houston. And we still have partnerships with those folks. And I actually was sent to Charleston, South Carolina as a part of that program to visit something called a living room, which is very much like a triage center in advance of starting up. So the localized visits, as the chairman said, that were done in the Chicago area, but even through SAMHSA and our getting matching grants and relationships there, building those federal relationships were super important, as well as with the state. I wish I could, I'm sorry I didn't prepare a super long list of the exacts, Mr. McCarthy, I apologize.
SAMHSA, by the way, Member McCarthy, with all our acronyms, is a substance abuse mental health.
Thank you.
That's a federal program. We did actually develop an acronym index for people to refer to. So when we talk through these things, people that are dealing with this every day refer to it. You know, I think everybody knows what's going on. Thank you.
Absolutely. I think I'm one of those folks that refers to that acronym index, and I greatly appreciate that. Thank you. I wanted a flavor, not a complete listening to, again, you know, I think it's important for everybody on the council to hear that there's an amazing amount of work going on. And sitting in the meetings is even difficult for me to keep up with all of the work that you folks are doing and Ms. Malott is doing. But it's as part of our fiduciary partnership with you, it's also good to see that you're leveraging those dollars to go out and to have a much bigger and greater impact in our community. And so thanks for that work. And
for
thanks
every
for
3 applications, we may get 1 or part of a grant. Which,
yeah.
And they're different arrangements for matching them, of course. Yeah.
Ms. Cummings.
Thank you, Mayor. I won't belabor tonight, but first of all, thank you, Ms. Rodriguez and Chairman McIntyre for being—
Ms. Cummings, can you turn your volume up?
Sure. Can you hear me now?
Better.
Is that better? Just a little, okay. Sorry about that. I don't want to belabor tonight, but I would like to start off by thanking Ms. Rodriguez and Chairman McIntyre for presenting a wealth of information. I just wanted, the only reason why I really raised my hand is I want to bring some clarification, because throughout the presentation a couple times it was noted that we built a jail. And so I just want for clarification for anybody who's watching that we didn't build a jail, that there was an addition, and that addition was specifically focused on behavioral and mental health, because I'm very trying to make sure that people get accurate information as they watch these, and that nothing gets left out there. So can you just make sure that it's, you know, and clarify that we didn't build another jail. It was just this addition that was created to specifically meet the needs as it related to mental and behavioral health.
Thank you for pointing that out. We also, we should probably stress that that project included a completely revamping and expansion of our jail medical facility. The nurses over there used to be in this little cubby hole in the old jail. And also it was a changing and upgrading of some within the Law and Justice Center. Besides the addition that you see, the second part of that was a restoration process that went on into some of the old linear jail cells and upgraded those for much better use too. So it was a combination of the two. Thank you.
Thank you.
Mr. Nord.
Thank you. A couple of quick questions. So the money that's being spent from this sales tax, is it fair to say that that the money is being spent on projects that everyone in the community or in the county can use, even folks that live in both Bloomington and Normal, not just the folks that live out in the country?
Oh, yes, definitely. You know, all of our jail, all of our court system definitely is a service that's provided. That's one role that the county plays as you know, as opposed to local. municipal government is that we do provide those type of all-encompassing services that are countywide for all our rural areas. And just for example, our information system out in the squad cars goes to all the rural police, not just ours, and not just our sheriffs, but also the other police that are involved. And so
Does it also, I'm sorry, does it also go to the town of Normal Police as well?
Oh, yes.
Okay.
Sure.
Yeah, because I think it's important that people understand that what you do doesn't just cover the people in the county, it's the folks that live in town as well, at least for these dollars.
Yeah. Part of our mental plan also has chairman's roundtables, and I've had every chief in the county in with me sitting down and discussing this and getting input from them. And when I say chief, either fire chiefs or police chiefs or someone. So they've all been involved either in writing the plan or help carry the plan out, along with our criminal justice system as well. As Ms. Rodriguez says, is coordinated with our Criminal Justice Coordinating Council too.
Yeah, I do think that it would be nice to have you guys come in maybe once a year and just give like an ROI discussion. So that way the public that, you know, pays attention to the normal council can actually hear that the money that we give to the county, how it's being used.
Yeah.
I just think that that's important. We've got Connect Transit that was supposed to come in and they had stopped, and now there's all kinds of questions as to who oversees them, and it would just kind of avoid that from happening in the county as well.
Sure, be happy to do that and file a report with you. All of our financials, of course, are public record and can be accessed even on our Behavioral Health Coordinating Council. And I'd encourage you to check out our BHCC website, because there's a wealth of news of services that are going on throughout the county and community from all our mental health and behavioral health service providers.
Sure. And then my last question is, since the VA clinic has come into town and they're a regional clinic, you know, they have said that they can't bring specialties until they have a need for it and people are actually using the clinic. Have you worked with them for some of these psychiatric services to see if maybe we could leverage them coming here to get some of these services that have been hard to bring in?
It's funny you mentioned it. I was just with Jerry Vogler, the director of VA, Saturday, and we were discussing some of those things. As far as working with that specific VA clinic, we have not been able to do that, as what you're talking about. Again, though, if there's any possible way we can bring any kind of basically psychiatric service, at least they are available for the veterans. It would be nice if there was a possibility we could ever incorporate and share these types of programs. That's what part of our collaboration idea was about with our plan. Thank you for mentioning that. I'll try to follow up some more.
Okay. Thank you. And it was nice seeing you guys.
Yeah, thank you.
Mr. Preston.
Yep, thanks, Mayor. I will just wrap up with somewhat of a familiar theme that, boy, it is apparent, if it wasn't before with this presentation, that there is a lot going on and that there is a level of complexity with the approach to addressing mental and behavioral health needs in this community. And I would just like to say thank you to Chairman McIntyre and the administrator as well for being with us and sharing that, and echo the desire for the maybe annual updates of this kind, something of the like, to continue to bring that value to the council moving forward would be greatly appreciated. Thanks.
Thank you, Member Preston. I will tell you that I was just commenting on recently that just over 5 years ago when I assumed the chairmanship, it was about the same time we got involved with trying to provide, identifying these needs, providing these kind of mental health services to help with the quality of life in this county as part of our county share. And we're doing this, you know, along with our health department, but this is extra initiatives that are identified. We couldn't have done this without you. There was no way that we could be able to do this. We're very happy to be involved in doing it. Our office got much more busy than we were at one time, but I'm happy to be involved in doing it. Thank you.
Great, thanks.
And Chairman McIntyre and Ms. Rodriguez, thank you for a very comprehensive update. I think got a lot of information to us in a pretty timely way, and appreciate you being here tonight. Thank you.
Thank you. Please call us if you got questions. Be happy to help you.
We move to the omnibus agenda, items that will be handled with one vote unless a council member would like to pull an item for discussion. Mr. Nord?
Sure, thank you. I guess to make it quicker, I'd like to pull everything except for item A and F as in Frank.
Please call the roll. Oh, do we have a second? I'm sorry.
I think Ms. Smith has her hand up.
Second. No, Councilman Nord covered mine.
That's kind of what I assumed there. So we have a motion and a second. Please call the roll.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
Aye.
Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mayor Kus.
Aye. We have approved the minutes of the regular council meeting of February 15th, 2021, and resolution to award a bid for water main and service line materials to Water Products Company Incorporated. Item B is a report to receive and file town normal expenditures for payment as of February 24th, 2021. Mr. Nord?
I so move.
Second.
Mr. Nord?
Thank you. Got two questions. Ms. Reese, on corporate counsel, there's an expense for $14.50 for matter 5069. And the questions that I sent before the meeting, you said that this was for utility work at railroad crossings. My follow-up question is, did any of this work have to do with the underpass location?
Mr. Nord, yeah, specifically in terms of Corporation Counsel, it was the invoice that you had inquired about, or excuse me, the payment to Klein, Thorpe and Jenkins. That is a law firm that we contacted for some outside counsel on a matter. I do not believe it pertained to the underpass, but I see Mr. Day just turned his camera on. So you can either do thumbs up, thumbs down, just I'm not sure if I'm accurate or not. Did I misspeak, Mr. Day?
You are accurate. I'm not sure which way my thumb's supposed to go. No, it didn't have anything to do with the underpass. That was an issue concerning placement of sewers under railroad crossings and duties to the railroad in those circumstances. It didn't have anything to do with the underpass.
Okay, very good. Just if it does, I just want to make sure that it gets allocated towards the underpass project. Then my next question has to do with the General Vehicle Replacement Fund. It's now called General Vehicle Replacement Fund, Innovation and Technology Administration. Would you please explain the various vehicle equipment funds and what expenses are set aside for each? Because this particular vehicle replacement fund, we're buying keyboards. And in the past, we've bought software, riot gear out of vehicle equipment funds. So if you could speak to that and say kind of who decides when to expense out of the vehicle equipment fund versus the general fund, and what criteria is used, because it doesn't seem like we're buying vehicles with it.
Sure. I'll touch on that, Mr. Nord. We've explained this in the past. This is called the Vehicle and Equipment Replacement Fund. That's the term that we have referenced for decades since we've created this fund. We use this fund to set monies aside from the general fund, and each of the enterprise funds have their own vehicle and equipment replacement fund. But this one that we're referencing is just, it's one pot of money, vehicle and equipment replacement fund, and all the general fund supported departments. This is where they put money aside for capital assets, such as vehicles, such as equipment, a significant expense like software, things where we need to set money aside and we want to, it's like our savings for our future acquisitions of vehicle and equipment and capital assets. In this particular instance, the Innovation and Technology Department made an expense. They purchased something and the funds were saved in the Vehicle and Equipment Replacement Fund. So that is where the payment came from.
Okay, and is there like a percentage that you're using to determine how much to fund this?
Well, it's based on when we purchase something, and I'm going to use an example or as a vehicle, or let's say a fire engine. A fire engine has, let's say, a 20-year useful life. When we purchase a fire engine for, let's say, $500,000, we start from the day we acquire it, we start setting money aside, knowing that 20 years from now, we're going to need what we predict would be $500,000 plus to make the next acquisition, so that when it comes time to buy the next fire engine, we have enough money set aside. So it's based on the cost of what we believe the cost is going to be, and then we start setting money aside each year to pay for it.
Okay, I understand that for depreciated assets, you know, like a vehicle, but could you speak more towards like keyboards, software, riot gear, things like that that are typically not depreciable items?
Sure. That falls under basically the equipment. So in terms of a particular dollar threshold, I guess we can ask Mr. Hune to talk about that. But as I indicated, it's generally capital assets. So it's funds that we think would be wise for us to start setting money aside year after year, rather than take one of significant expense out of the general fund. So this is our basically a sinking fund for various equipment expenses. And then each department that makes an acquisition out of that fund, it's showing up as vehicle and equipment, innovation, technology, or vehicle and equipment, police, because that's where the money was set aside under that particular department's future expense. Hopefully that explains it.
It explains it. I don't know that I quite agree or understand. I guess that's probably not this is probably not the time for that, because you've got things like keyboards, you know, which might be considered more disposable items that we're now using this fund for general item expenses. And we're planning on putting $7 or $8 million into this fund anyway, that we're already demonstrating can be used for things other than vehicles. And I just wanted the clarification just tonight. So this isn't gonna say I'm against approving the keyboards. It was just
Sure.
My understanding why this is under keyboard versus IT, or whoever's getting the keyboard. That
the alternative, I'm sorry to interrupt you. The alternative would be the same expense, just a different checking account, basically. So 6 of one, half dozen the other. This is where the money was set aside for an acquisition of keyboards for the organization. They bought 2 this time at this particular expense. They might buy more later on, but this is where the funds were set aside for it. If we didn't set the funds aside in the vehicle and equipment line, we would have paid for it out of the general expense line. So that's just how we've set up the operation.
Okay, thank you. That's all I had for this item.
Ms. Lorenz, excuse me, Ms. Lorenz.
Yeah, I was just going to suggest that we get back to the point of the issue, which is to receive and file our bills. Thank you.
Thank you. Please call the roll.
Ms. Cummings,
Aye.
Mr. Nord,
Aye.
Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Mayor Kus.
Aye. Report to receive and file is approved. Item C is a motion to accept a proposal for auditing services from Lauterbach and Amann LLP for an additional 2-year term. Mr. Nord.
I so move.
Second,
Mr. Nord?
Thank you. My understanding is this contract doesn't expire until after the 2021 audit is complete. When about will that be completed?
Mr. Nord, the auditor generally reports back to the city council in your first meeting in September. So they perform their on-site work generally in around June. We close our fiscal year at the end of March. They're on site in early summer, late spring, so June, July. They conclude their work in August and report back to council, typically the first meeting in September.
Okay, so this contract really wouldn't start until next June, like June of 2021.
Correct,
Is-
but we don't wait until the last minute to talk to our auditors. We're talking to auditing, or whoever our auditor is going to be. We're working with them throughout the year to prepare for the audit and making sure we have things that they need when they're ready to start their work. So in this particular instance, I think we pointed out in the council report that what we're talking about is auditing services for fiscal year 21, 22, and 22, 23. So that would be at the end of the, when those fiscal years close.
Sure, okay. So then this isn't something we have a rush that we have to decide on an auditor for right now. The reason I bring this up is because in the IML magazine, which, you know, I know the town puts a lot of weight towards what the IML says, you know, best practices and articles that are in there. Well, after the Dixon, Illinois incident, the IML had an article in there. This is one that actually spoke at the council and read the article and some of the points in it. One of the points was that they recommend changing auditors regularly. So a fresh set of eyes looks at the books. And my question is, if that's becoming the best practice for municipal government, you know, it seems like we should have another auditor look at the book so we have a fresh set of eyes, because we don't know what someone else looking from a different perspective is going to identify. If these folks haven't identified anything, fantastic, the town's great. You know, now let's get a fresh set of eyes to look at it from a different perspective.
Exactly. That we have the same point of view. It's just that our recommendation has always been 5 to 7 years maximum for an auditing firm, and then we switch.
Okay, the contract was for 5. We've got time. And if this is the best practice from the IML, I move that we table this for, how long would it take you to get bids from other folks?
I don't want to just throw out a date. I would take at least a few months before we could come back to you. We would have to put a proposal together and then issue an RFP and then push it out and then get responses. But certainly if council is comfortable and prefers somebody else coming on board, then when we can go through that exercise, we just are making an alternative recommendation. So.
Sure. Well, then 90 days. And if you get it, if you need more time, then I would vote to give you additional time, because we don't need this service until next year. And, you know, especially since this is something that the IML has recommended to do, I just think it would be following best practices and being good stewards for our taxpayers' resources to rotate auditors. And we're following the direction of the folks that, you know, the town puts a lot of weight in. So
right.
I guess I'll make my official movement, which is I move that we table this decision for 90 days to allow staff time to identify an alternate auditor.
If I may, Mr. Mayor, I don't believe that motion is in order.
Okay.
Under Robert's rules, there are 2 options for tabling. You can table it until the next scheduled meeting, or you can table it for, I'd say motion to postpone indefinitely, which would essentially kill the motion to be brought back at a later time.
Then I'm curious, we did a motion to table the One Normal Plaza, and that was beyond 30 days. and it was reliant on something that the governor had to do. How can we do the same thing, but instead of it being reliant on the governor, it
Mr.
is
Nord,
reliant on the staff?
We have an opinion from our parliamentarian on this
And
issue. We have an
well,
opinion from our parliamentarian on this issue.
I've
So
got
the
a
motion
question
is
for the
to table-
parliamentarian that I'm asking.
In short, Mr. Nord, that was a different form of business. That wasn't an agenda item before the council.
It was an agenda item because we voted on it the night that it came before us.
Well, we voted as the moving party in that proceeding to postpone the hearing. A request for the commission to hold a hearing. That's different than voting postpone an item, a business item on our agenda during a meeting.
Okay, well then let me ask this then. How should this be phrased if my intent is to simply have another auditor be presented to rotate following the recommendation of the IML? How
Mr.
should
Nord,
this be phrased?
Mr. Nord, it's your motion. It's up to you to phrase the motion. You've been told that there are two options on the motion. That is to postpone indefinitely, which kills the motion, or to postpone till next meeting. You're making the motion. It's up to you to phrase it the way you want.
Ms. Reese, which would you prefer since you kind of control the
Mr.
agenda
Nord, we
going
have a
forward?
motion. Do we have a motion?
I'm trying to ask the best way to phrase this. I mean, we
Mr.
have a
Nord, it is your-
parliamentarian
Mr.
to
Nord,
ask questions
it is
of
your
how we
motion.
do things.
It is your motion. The parliamentarian told you you have two options to phrase the motion. So phrase the motion the way you choose to.
Okay, well, I want to make sure that it's feasible for the town manager.
Mr. Day is our parliamentarian. He has given us a ruling on that.
Okay, can I ask the town manager a question since she's the one that's going to have to do the work for this?
No, you may
I
not,
cannot ask the town manager a question.
not about this issue.
Well, I just want that on the record that I asked town staff to answer a question of mine and you
And town
told
staff
them
did,
no.
and town
So-
staff did answer the question. So what is your motion, Mr. Nord?
Well, to table this for the next meeting, and then I'll probably ask to table it for the next meeting after that until we have something.
Is there a second to the motion? Motion fails for lack of a second. Ms. Smith?
Yes, on this proposal, there's a quote for the audit and there's a separate quote for a single audit. Could you please clarify what the language is referring to when it discusses separately a single audit fee?
Yes, and I'll ask Finance Director Andrew Hune to join the discussion. The single audit is directly related to particular grant amounts. Mr. Hune, do you want to clarify, please?
Certainly, yes. The town will receive a regular audit from Lauterbach and Amon or auditors, and that's priced accordingly. If the town requires a single audit, that means that we've received over $750,000 of grant funding for the year, and that triggers a single audit is triggered after that amount. So they're uncertain if we'll have that kind of income come in from grants or not. In some years we have, in some years we have not. So if we get more grant money over that amount, then that triggers that audit and triggers more work from the auditors to issue a different opinion, a separate compliance audit, kind of a control audit of how we manage funding in terms of transactions. So it gives them a lot more work to do if we do receive a certain level of grant funding. Go ahead.
And I apologize if I'm talking over you. I'm getting a slow feedback on my signal here. And it's alerting me my internet connection is unstable. So let me forge ahead. So the grant audit, would that be cumulative grant funding, or would that be a single audit in excess of $50,000?
It's not cumulative. Well, it's for any kind of grant money we get during the fiscal year under audit is evaluated. So if that money annually received under that audit year exceeds $750,000, then that triggers a single audit. If it does not, then we do not have a single audit.
So grant funding is tracked to compliance and expenditures related to that grant, and to make sure that there's no mingling of funds or work dedicated specifically to that grant if it exceeds 750,000.
Correct. We track all the grant expenditures if they're $1 or $1 million. Again, if we reach that threshold of 750, then that does trigger an audit from the auditors for a single audit. That their requirements step in then.
And in terms of the time frame for wishing to extend this to take advantage of in my communications by email with the city manager, there was a discussion of the fact that given the complexities of COVID and from an auditor standpoint, there are some additional accounting standards being implemented in the next year, that those complexities, it was just perceived that it would be less cumbersome to make a change in auditing firms at this time, and to go ahead, because audit work does involve pre-planning, pre-audit planning, the actual audit and post-audit follow-up. It just seemed logical to take and extend the contract for 7 years to make sure that this process can proceed smoothly with a firm familiar with the process, so that we don't incur the expenses of a new auditor who has to recreate all of their audit work papers from scratch. Was that part of the thought process?
Yes, indeed it was. We have a good relationship with Lauterbach and Amon. There are some complexities coming up with different GASBs that are required. We have some of the decision also acted towards the fact that we have some resource issues with COVID right now. We would need to do an RFP pretty much immediately to start that process for their timetable and ours. And honestly, primarily, we're certainly within what we feel is the best practice of 5 to 7 years of rotation. We would not recommend going past 7 years. We think that is appropriate cutoff at this time, given other circumstances. But I think we're comfortable with this recommendation.
And when the staff researched the fees that this firm has been charging, they are not increasing the fees on level with what is becoming the industry standard to see 6% or more increase in fees. And I passed that communication on. And if anybody wants to see it, I'm happy to share that with you. It came from my mailing list with the AICPA. So I'm in agreement to extend this for the full 7-year period, given the complexities of implementing new standards, auditing standards as it pertains to governmental accounting, and also the staff time to assemble an RFP, and all of the changes that the town has gone through in dealing with COVID. Thank you.
I was going to make a comment earlier that we do indeed follow guidelines, and I think this is the second year that Lauterbach and Amon has done an audit. We had a pretty different auditing firm previously, didn't we, Mr. Yun?
Yes, this will be their 5th year of audit with us, but prior to them, we had an audit firm that was on for a 7-year period, I believe. They were on for the first 5 years, and then at the time the council approved a 2-year extension for them. So in my tenure, we've always kind of stayed at that 5 to 7 year rotation to adopt the best practice of getting a fresh look after a number of years has passed with the new auditors.
Thank you.
And I will jump in, Mayor, and indicate that it's been the town's practice to change out our auditors pretty regularly. So that has been something that's not new to us. It didn't start when Dixon hit the national news about the things that they were happening. And I think in that particular instance, Dixon had an auditing firm that they'd been using for 20 to 30 years. That is not our case. So in just to clarify, what we're asking council tonight is support for just 2 additional years so that Lauterbach and Amen would be our auditors for a total of 7.
Thank you. Mr. McCarthy.
Thanks, Mayor. Make sure I lower my hand. I'll get in trouble for that. Actually, most of the questions I had for staff have been addressed. I sit on a handful of other boards that all have audit firms involved with them. And it's been very common on those boards, practice of audit firms keeping them for every 5 to 7 years for to ensure that they don't incur the extra cost of changing, because that is a costly, not just from dollars and cents, but on staff. Internal staff in those agencies have a huge job in bringing on a new audit firm, a lot of extra time, creating new work, more papers. So it's a very costly transition for whatever agency is bringing on a new audit firm. So I think that's also important for us. But again, I just want to make sure that I heard accurately that 5 to 7 years is a common practice.
Yes, it is.
We got a very audible nod.
Yes, that is absolutely accurate. And like City Manager Reese said, back in the day, you would have an audit firm for 20 plus years,
right? And
they'd essentially become like almost an extended staff. And that changed for the private industry with Sarbanes actually years ago. And then IML and other government agencies kind of came forward. And I don't know, I didn't read the IML article that Councilman North is referring to, but typically what we've seen is the 5 to 7 year window is appropriate to get away from these long-standing 20, 25 year relationships that become pretty counterproductive for a lot of reasons.
Mm-hmm.
Thank you.
Ms. Lorenz.
I want to go back to, well, first of all, I support the 2-year extension, and it's, we're talking about a total of a 7-year relationship. So we've achieved 5 to date, and we're looking at a 2-year extension. And in my tenure of 1.5 terms, we have switched over from the previous auditor to the current one. So I think that the 5 to 7 years seems to be a reasonable sweet spot between not changing often enough and versus changing what could be considered too often. And this is the point that I guess I want to bring back to the concern that Mr. Nord had about, well, what do I do in this situation if I don't feel comfortable about the extension? Tabling is probably not the way to go, as you kind of ascertained there. And so just simply vote against it would be my recommendation to you. Now, having said that, it's something to consider that changing too often is going to be an additional cost to the town and thus to the taxpayers. So, careful what you wish for here. So, there's that, like I said, that sweet spot between not changing often enough and changing too often, whereby the perhaps unnecessary cost is incurred by such frequent changeover. So just wanted to offer that up for consideration to my colleague, Mr. Nord, and careful not to waste taxpayer dollars on too frequent of a changeover here. Thanks.
And Mr. Nord.
Thank you. Couple of comments that I wanted to make was our budget process in the town is award-winning, and it's award-winning because it's put together consistently. So that way another auditor that comes in, they are familiar with the format, so I don't agree with the concept that if we get another auditor, they're going to have to relearn our system, what everything is, because if that's the case, we're not doing things according to a standard. And that is alarming. And then I would question, what's the point of the award if it's not putting things together consistently so someone else can look at it and understand what what the financials say. Another thing to point out is not just Dixon, Illinois, but here our neighbors right next door, Bloomington, the Coliseum. They just had something here over the past few years about the folks running that using money inappropriately. And there was a court case and things like that. So possibly a different auditor may have spotted that sooner. We just have no idea. But I kind of get that there's not support to table this or do something different and just limit it to 5 years. So I'm going to see if there's room to meet in the middle, if we can come to a consensus. And this is a 2-year contract. Staff has said that, you know, they would not go beyond 7 years. You know, the sweet spot is between 5 and 7. Well, between would be 1 year. So I'd like to see if we can negotiate and maybe meet in the middle on this. And I'd like to make a motion to amend the contract to 1 year.
Is there a second? Motion fails for lack of a second. And I would reference back to what Ms. Lorenz said, just Mr. Nord, you ought to think about voting against something if you don't like it instead of trying to constantly amend it.
Oh, I was trying to meet in the middle is what I was trying to do.
I understand. Ms. Smith.
If I can address the point Mr. Nord is making about whether or not it is a simple process for a new auditing firm to step into the role of becoming the town's auditor. Because an auditing firm is new to an engagement, they are responsible for creating their own working papers and documenting all of the systems that are in place. Regardless of how clean the town's finances are, or how readily the systems in place lend themselves to oversight. The auditing firm, in their due diligence, is going to want to obtain copies of every contract. They're going to want to obtain copies of every amortization table. They're going to be wanting to look at and test more stringently as they verify and validate that the internal control system can be trusted, that there are measures that a new auditing firm must responsibly take in assuming the engagement. And this is what adds to the cost of a new auditing firm accepting an engagement with a new client. And so it is not a reflection of the town's financial systems as to how difficult it may be for a new auditing firm. It is simply the process itself for an audit. And as any good CPA will tell you, an auditing firm is not responsible for finding fraud. That requires a forensic audit. And in the town of Dixon, which you've referenced in that IML article, there were signs that there were things that were problematic that led to the investigations. There were signs and red flags in other cases, but the town of Normal is not exhibiting any red flags that would cause a question of, should we pursue further than a financial audit? So again, I'm in favor of continuing this contract for 2 more years. It's a cost savings to continue to have an auditing firm who already has their working papers in process, and that they are going to do the due diligence that every auditor is required to test for internal control, and then to validate that the proper accounting standards have been applied correctly. And so I will be voting to approve this. Thank
you. Mr. McCarthy?
Lower my hand. Thank you, Mayor. I won't repeat everything Ms. Smith said. We're very much on the same line of that. And, you know, there was a whole bunch of assumptions that changing auditors was based on the town's books, when in reality it's not. It's based on a whole lot of things that Ms. Smith aptly spoke to. I do want to emphasize that we have no red flags. There is no questionable practices, and you know, the Coliseum was brought up, and I just want to make sure that that it's clear in the public and that's watching in the media that that was a completely separate situation. It was a completely separate organization, separate from the city of Bloomington, who was running those books outside of the purview of the city of Bloomington. And so what we're talking about is auditing our own books that is wholly under our own auspices. So although that was obviously a very difficult and unfortunate situation, a completely different situation and very much unlike our own. And again, with no questionable practices, I'm very supportive of this. Thank you.
Please call the roll.
Mr. Nord,
No.
Ms. Smith,
Yes.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mayor Kus.
Aye. The motion is approved. Item D is a resolution approving an amendment to the Community Development Block Grant Programs 2020 to 2024 Consolidated Plan and 2020 to 2021 Action Plan. Mr. Nord.
I so move.
Second.
Mr. Nord.
Thank you. Ms. Reese, we kind of emailed a little bit back and forth about this one. I just wanted to clarify that I read correctly that this money is for housing and more indigent needs, and the township, who's responsible for more of the indigent needs, they've said that they have no interest in managing or accepting these funds. Is that correct? And that's why we're giving them to the MCCA.
We're not giving them to the.
Well, Mr. Nord, first I want to mention that we have Mr. Long and Ms. Davison on the line here to answer specific questions if council wants to talk about the CDBG program in more detail. This is a continuation or an extension, I should say, of the housing and basically the living assistance through the CDBG program, the dollars that we received through the Coronavirus Relief Act. And council might recall that the first wave of funds that we received in 2020, we coordinated with Mid-Central Community Action. They have staff that is trained to administer the program. They're working closely with Mr. Long and Ms. Davison on this. And back in early 2020, with the first wave of dollars we received through the federal program, the township, Normal Township, had a lot on their plate regarding the services that they're providing, and determined at that time that they weren't staffed and chose and didn't feel that this was a program that they could administer on our behalf. So we moved forward then with Mid-Central Community Action, and we shorten that typically to MCCA. So we have a strong partnership with Mid-Central Community Action on this. They are staffed to continue administering the program, and it is becoming more popular, unfortunately, as a resource for our residents and for our eligible residents. And so in a nutshell, yes, you're right that in past conversations with the township early in 2020, they were not staffed appropriately or accordingly to operate this program for us. And so we moved forward with MCCA. So we're asking tonight for council just to continue on in the program with MCCA.
Okay, so was the township asked with this round of funding, or are we just assuming that they still have no interest?
Well, I can say I don't know that we're assuming they have no interest. And I'll defer to Mr. Long for specifics, but we also know that we've invested in MCCA and we're covering staff, and we've been working with them for months on this program. So we could pivot probably if the township was interested, but we have an existing program that we're trying to build off of. So Mr. Long, is it okay if Mr. Long jumps in to supplement my answer?
I don't know that, I guess really my question is it the proper chain of command, if you will, for us to contact the other governmental body before we give it to MCCA? Have we done that step? Is that something that we should be doing? If it's not, then I don't know that I have an issue.
Well,
It's just, I want to make sure we're not skipping a step.
I'm not sure that there's a step that would require us to contact other potential partners. We are using this as an extension of a program that currently exists.
City Manager Reese, if I could step into here and add something. Everything City Manager Reese is completely accurate. We reached out to Normal Township about this, and the idea of this was last spring. We reached out to them asking, maybe do they take some amount of funding, because we knew this is that first allocation that came, that 246,000. That's quite a chunk for certainly the town to administer by itself, or even with one partner. So we thought about maybe working with MCCA and Normal Township and some division of funds and services. Normal Township at that time was they have their own program that they run with state funding, and I'll add here too that it's a completely different animal what Normal Township runs and CDBG-CV is. And the benefit of now having worked with Mid-Central Community Action, who already had some expertise in federal programs like these, is we've been doing this program for, unfortunately, just not quite a year yet, but we have been running it some time now. And they know the heavy amount of documentation that's required of CDBG-CV as opposed to Normal Township or any kind of township state funding that they receive. That said, to Mr. Councilmember Nord, we did speak to Normal Township. I won't pretend to speak for them or the organization, but we did speak to them. I think it was 2 months ago when this council voted to allocate the remaining amount of that first allocation toward this program. And again, same story. They've got their own program they're trying to run and their own capacity issues. So as to did we reach out to them for this specific amount of funding? I don't believe that's the case. We're in regular contact with all of our service providers. So it would have been, if they had an interest at any point here in the discussions, they could have chimed in. But like I said, they've got their own program. They're running all, MCCA has its own, it's regularly running. We just have our own kind of, piggybacked program over there that they have, some expertise in running. So now that we've invested all this time and some amount of money into as well for staff costs. So we're very, very, very appreciative and thrilled with the work MCCA has done up to this point too. So it's staff's recommendation that we continue to follow in this path moving forward.
I think the salient point here is that Ms. Reese made the observation that we're not necessarily required to do that, to make sure the township doesn't want it. There's no hierarchy there that we're abusing. Further on this item? Please call the roll.
Sorry, my unmute wouldn't click on. Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
Aye.
Mayor Kus.
Aye. The resolution is approved. Item E is a resolution to accept bids and award a contract to J.G. Stewart Contractors Incorporated for the 2021 miscellaneous sidewalk improvements, 50/50 sidewalk and ADA ramps project in the amount of $523,338.90. Mr. Nord.
I so move.
Second.
Mr. Nord.
Thank you. Prior to this meeting, Ms. Reese had sent the council a list of all of the, I guess, well, maybe I'm making an assumption. The list that you sent, Ms. Reese, does that list mean that all those locations will get their sidewalks updated by approving this?
Not necessarily, Mr. Nord. I'm going to ask City Engineer Ryan Otto there he is, to turn on his camera. And if all right with you, I'd ask Mr. Otto to respond.
But Mr. Otto, just in interest of time, since I'm limited by how much time I have to speak, really, if you just give me like the number of pages, what is going to be completed and what's not.
Sure. So the list you received was a list we included in the bidding documents, and it's more illustrative in nature than specific, in the sense that we wanted to give bidders a sense of what areas of the town they'll be working in. We often get the question from contractors, well, where will the work be? Well, the answer is the work is spread out throughout the town based on areas that need repair, areas where we get complaints, areas where our inspection and rating program has identified areas of concern, as well as partial funding comes from the CDBG program. So we are limited to using those funds in the low and moderate income areas. So we have some limitations, and we use a rating system to prioritize ramps, to prioritize the sidewalks. We continue to work on inventory. So I guess in short, the list you see is very preliminary in nature. It's not necessarily a guarantee that we're going to fix those areas. It's just areas that we have on our radar. We will refine the budget as we go forward. In other words, we do not perform detailed design on every ramp. That's cost prohibitive, and to use that kind of level of engineering to go out with a bid. So we have preliminary locations we give, and take that list and give it to the contractors so that they at least know that some of the areas are going to be in for the work. It helps them bid, and I think it helps reduce our bid prices as well.
Okay, well, there's like 4 pages. Would you say 50% will actually get done?
I can't give you a number. I would say well over 50% of those would get done. Probably, hopefully, closer to all of them. But I can't say that with any certainty, because there may be an area that we identify we need retaining wall, for instance, in that location. The cost goes up, so then some of the areas drop off. But we do have significantly more funding this year. Appreciate the council's support for that. The increases to the funding for the roadway have allowed us to bid. I think this is probably, I don't know for sure, but I think this is probably the largest sidewalk contract the town has ever let. So we're excited about that, and we're hoping that we can get to a majority of the locations as shown. We also get requests throughout the year, and we try to add those as well. Obviously, we prioritize ADA compliance and concerns that come in.
Okay, and then speaking of the ADA compliance, was LifeSil or some of the ADA advocates involved in prioritizing these?
Absolutely. We talk frequently with LifeSil. We've got a great relationship and appreciate their input. We get requests from them occasionally, and certainly those become top priority when we get those.
Okay, good. Because I know some folks that have got children that are wheelchair bound, and I saw their neighborhoods on here, and I just want to make sure that they're not going to get missed if people just don't know that would be a priority. So I'm glad that they were involved. Then the Landmark Drive sidewalk, that's like a $200 and some $1,000 project, which that's nearly 50% of this budget. So after we discussed this at the budget meeting, I was contacted by some businesses there on Landmark Drive. They had concerns about why that particular extension was needed. They wanted to know, what was the complaint? Who made the complaint? What's the cost to the taxpayers for it, which is going to be the, nearly $250,000. And what's their responsibility if this gets put in, as far as like snow removal, ice removal, things like that, because they've never had a sidewalk out there. There's one across the street. So I'm kind of at a loss as to why we're approving this, and want some documented need for it, so these folks understand why they're going to have to pay to have a sidewalk put in when they don't see a need for it. And are there better places in the community that will get a benefit from having their ADA ramps and things fixed where there are currently known problems?
Well, I'll jump in first before Mr. Otto supplements my response. But in terms of a sidewalk on Landmark Drive, this is something that's been discussed for a couple of years for anyone who is a Connect Transit user. I'll give an example. The Connect Transit bus stop at Kroger on East College is in the middle of the landscape
In the
rock.
middle of rocks. Yeah.
River Rock.
Right. So certainly a sidewalk makes sense to be able to access the bus stop. And so there's a couple of bus stops, Connect Transit stops on the west side of Landmark Drive. So I'll let Mr. Otto talk about the impact to property owners and what the expectations would be. Mr. Otto?
Thank you, Ms. Reese. Yeah, and just to clarify, the Landmark Drive sidewalk is not part of the contract that's before you tonight. That'll be bid as a separate contract later on in the spring, summer. We have finished the design of that and are starting to reach out to property owners to obtain temporary easements for areas where we may need to redo a driveway or do some grading to save some money. So we're starting to meet with owners with that. So that would bring the total roadway investment, the roadway fund investment in sidewalks this year to over $800,000, which again is a significant increase in funding over previous years. As far as our meetings with property owners, when we meet with them, we have occasionally gotten comments such as you received about, wanting to know the scope and the why of the project. And I think it's easy to explain in that the two bus stops that are there and the access that's required from those stops to various employers. Mark First is down on Hunt Drive. So if someone gets off on those two bus stops, there's no access or ability to access the Mark First Center.
They have to cross the street anyway. Going from the west to the east, they just cross the street and then there's a sidewalk there. I mean, so they easily can access if they get off there.
I'm going to interrupt here since Landmark Drive is not part of this contract. I think we should move on from that. And you can bring those issues up when that contract comes to us.
That I would agree with you on, and please contact those business owners before, I guess, you move forward with that Landmark Drive. But thank you for clarifying that was not a part of this.
Ms. Smith.
Just to clarify, so transportation dollars are being used to fund sidewalks. And so for people who do not drive, do not have a car, this is a way to get mobility. And in the meetings with Connect Transit, what was pointed out was that until all bus stops are ADA compliant, the system doesn't work for everybody. And as you point out, on Landmark Drive, that bus stop is sitting in the middle of River Rock and would not be conducive at all to a wheelchair. Mark First is across the street. There are a number of SOAR participants that work at Kroger and are dependent upon that Connect Transit to get them to their jobs. And so it is my understanding that these sidewalks priorities were coordinated with Connect Transit for their Build a Better Bus Stop program where applicable. Is that correct?
That is accurate, yes.
Okay, so there is an effort being made to have the town of Normal provide the work that is necessary for the Connect Transit to honor its pledge to be accessible to everyone by making as ultimately all bus stops ADA compliant. And so this goes a long way in using transportation dollars for citizens who aren't primarily dependent upon cars. Thank you.
Mr. McCarthy.
I want to note it that I haven't violated the raised hand policy. Yeah.
We're only halfway through the meeting, Mr.
I just a quick dovetail off of Mrs. Smith's comment. I had the same, is that just reminding everybody that in our and the number in the many Connect Transit conversations that we've had, that sidewalks was very passionately advocated for in some of those discussions by Mr. Nord and others. and that as part of the Better Bus Stop campaign, and helping to make sure that eventually we get to 100% accessible that Ms. Smith talked about, that we all agreed that sidewalk investments was critical, and that was part of what the town could do to help the transit system make it very accessible. So I do have a couple of questions for staff, presumably for you, Mr. Otto. So if I'm hearing correctly, although this might not be the exact list, but these funds will all go to sidewalk and sidewalk related work. Is that the gist of what I'm hearing?
Yes, that's correct. Yeah, the engineering for this was performed in-house. The inspections that we do were performed in-house. So all the dollars you see through J.G. Stewart will go into work on the street.
Great. And last question, I'm assuming then that means that there's some sidewalks that aren't on this list that might get done as part of, say, our 50-50 shared cost sidewalk program. Does that come into this at play, or is that a completely separate program?
No, that's accurate. Yeah. So we get requests throughout the year. Our 50-50 program is available for town residents, and that program is primarily used for sidewalks that a resident wants replaced in front of their home. Usually it's areas that may not make it high on the prioritization list for the town. Maybe there's some cosmetic issues, for instance, or some other issues that we could perform a smaller repair rather than replace the entire length of sidewalk, but they want the sidewalk repaired anyway. So we would accommodate them like that. It's kind of a win-win that the homeowner can participate and the town can also participate. If for instance, a property has a sidewalk that's completely unserviceable for various reasons, the town does pick up that full cost. We don't make homeowners do that. It's primarily we use the 50-50 program for those questionable areas that may not rise to the level of getting done that particular year, is what that program is used for.
Got it. Thanks very much.
You're welcome.
Mr. Nord.
Thank you. So that Kroger bus stop has probably got 20 feet of gravel between the pavement there at Kroger and the bus stop. With this vote tonight, will that bus stop get pavement so folks that are in wheelchair or walker can actually use that bus stop? Or will it have to wait for that $230,000 expense or $253,000 expense?
That's a separately designed project and will be separately bid for the entire sidewalk.
Okay, so we have to put in the entire stretch of sidewalk from Rab Road all the way up to Tawan, all the way up to College, to be able to get that one bus stop fixed?
It's part of the project, Mr. Nord.
Not Rab.
Well,
Mr. Otto, do you want to explain
it's not Rab, but it's Fort Jesse. So
what the
Fort Jesse
design
to
plan is?
College.
Sure, I'd be glad to. No, the extent of the limits for the project are from College Avenue all the way to Arbor Walk Court, which is a private drive. It does not go all the way to Fort Jesse, just for cost reasons. And the section we're proposing encompasses the two bus stops. There's the bus stop at Kroger, but there's also a bus stop further to the north that folks use a lot, closer to Portillo's. That's in addition to the bus stop on the east side that's directly in front of Portillo's. So there's actually 3 bus stops, but only 2 are on the west side of the road. So this ensures accessibility for both those stops. Like I said, it brings a lot of connectivity to the area. And again, it's come up in numerous conversations with persons with disabilities and advocacy groups. And that's why the project was brought forward in the first place a couple of years ago. So we're excited to be able to deliver that later. But again, it's not part of this project tonight.
Okay. Is it possible? Well, I guess maybe that's a discussion for later, but I would sure love to see that one bus stop there at Kroger get fixed, even if we don't approve the $250,000 sidewalk extension.
The bus stop at Kroger is included in the project. I'm not sure where the $253,000 estimate you reference came from. I believe the cost estimate for that is actually closer to $300,000 for the construction of that.
Yes. So
So that
I would-
includes, and we've talked about that a little before, in that the driveways have to be replaced through there because of cross slope issues with the existing driveways. So it's not as simple as putting in a sidewalk in a greenfield area. We're doing a lot of extra work to accommodate the businesses. There'll be staging to keep the driveways open. And again, we're going to have all those conversations with businesses as we look to obtain those easements and meet with folks individually out there.
Mr. Otto, what is the timing? I mean, we haven't gone out to bid yet on that project, so that's different than what's on your agenda at this moment. So, Mr. Otto, when are you going out for bid, or when do you plan to go out for bid on the Landmark Drive project?
It will be late spring or early summer. We've, like I said, we just began talking to folks regarding it. We have not talked to everyone out there. Again, that takes time to answer questions, but we think it's worthwhile so that everyone knows what's going on before we bid the project.
So we'll come back to you when that one's been bid and ready to go. And in the meantime, we've got $500,000 plus to go toward sidewalks throughout town and ADA ramps.
Mr. Otto, I've got one question for you, one last question. Do you have enough engineering done to be able to at least put in the sidewalk so that bus stop at the Kroger location, the one that's in the gravel, can be used so people can get in and out of that Kroger complex?
We do. We've not finalized our negotiations with Kroger. We're still discussing with them issues of access, landscaping. That conversation continues. But so we're not ready to put that in, I guess, if that's your question, but hope to be in the next couple of months in time to bid the project. So there shouldn't be much delay depending on what contract we utilize to do it. It's a matter of maybe a couple months at most. It's certainly more cost effective to do when a contractor mobilizes to the area to do the entire stretch. So in terms of value that we can get for our money, I think waiting for that larger contract where the contractor is going to be in there and mobilize is probably the best option.
Sure. All right.
We can certainly do either way.
Yeah, this is only 20 feet away from the existing pavement there at Kroger. So that one little piece, even though it may save your department, I don't know, I got to imagine it's not going to be a whole lot of money since it's only a few feet of pavement that we're putting down in that entire area. I'd like to see that expedited. Is there a way to move that over to this approval that we're doing tonight so it's not dependent on what you said was nearly a $300,000 pill to swallow to fix one bus stop?
If I could, Mayor, I can pledge to Mr. Nord that we'll take a look at this, and we certainly understand that that bus stop is a priority. We agree. That's why we've been working on this project. It's not going to be just simple in terms of just slapping down some concrete and putting in 20 feet of a walk to the bus stop. It's a little more complex than that, but we understand it's a priority. Staff will look at it, and I'll get back to council. I'm just going to ask that we not try to throw that unplanned project onto this mix, but staff will get back to council on how we can, as promptly as possible, get a paved walk to the Kroger bus stop. That's not the only bus stop on the west side that doesn't have a walk to it, though. So I understand your priority. We'll look at it. But as Mr. Otto indicated, generally, because of the complexity of the Landmark Drive West Side sidewalk, it might be a better price to have a contractor stage and bid on the whole thing. We'll take a look at it, and I'll get back to you.
Okay, thank you. Then for next year, I would request that the list of sidewalks that are going to be fixed be shared with the council far in advance. So if we have something like this that someone's passionate about getting addressed, we have time to do that. So it's not thrown in at the last minute like it is tonight. You know, give council the ability to give you this information so it can be planned in advance instead of us finding out about it 3 days ahead of time and then kind of last minute adding it.
Well, Mr. Nord, that Point well taken. We'll include the bidding list, which is preliminary list, as I've shared with you. We'll include that in the future. But just to be clear, tonight is not the first time that we've talked the Landmark Drive sidewalk. We've talked about it in the past, and I'm certain we've explained in the past that it's a separate contract and it has been a priority. I think it's maybe even been addressed in the CIP. So, you know, we're spending time talking about it tonight, but that's not what we have on the agenda because that's a different project.
Ms. Lorenz.
I would like to move to the previous question, please.
Thank you. I think we're at the point we're going to have a vote anyway.
Okay,
You want to withdraw that?
that's fine.
Please call the roll.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
Aye.
Ms. Smith,
Aye.
Mayor Kus.
Aye. The resolution is approved. Item G is a resolution to accept the bid and approve a contract with Northern Illinois Fence Incorporated in the amount of $245,066 for the Maxwell Park OSLAD grant project fencing.
I so move.
Second.
Mr. Nord?
Thank you. As I've shared with the council, talked with the folks in St. Charles, Illinois. They had some concerns. Actually, before I get onto that topic, I was walking around this park where these fences are going to be replaced, and the fences don't appear that they need replaced. After talking with Parks, this is more for cosmetic reasons than because the fences have deteriorated. So this project is 50% more than what it was anticipated to cost because of the impacts of COVID and increased steel prices, so price of the materials. So, you know, this is money that we're spending, not because we have to, but because we want to, and we're spending more, 50% more than what we need to. So I would like to understand why it's so necessary that we replace this fence. If it's cosmetic, why can't we just paint it?
Sure, Mr. Nerd. We did have some exchanges about this today. I'll ask Mr. Damry to talk about it because just to remind council and the listeners, this particular action item is related to the Maxwell Park overall improvement that we received a grant award in 2019 for. The state of Illinois is contributing $400,000. There's a mandatory $400,000 match from the town. So the overall investment is $800,000 in Maxwell Park renovation. 2 weeks ago, council authorized an agreement with Stark, or a contract for the work to be performed by Stark Excavation in terms of the improvements at the park. Now the last item here for council action is the new fencing. And Mr. Damry is going to explain why we are asking council to authorize this fence contract.
Yeah, the field was originally built in 1978, and it was identified in our Maxwell, or the master plan in 2015, as a project that should be considered in redeveloping the field area between and around to allow for better. There's a number of issues out there. So those fences are 43 years old. So in addition to that, we were looking at right now the dugouts are well into almost in the outfield, which is very unusual. It's probably when it was built in 78, you know, may have been more of the norm. So we're shifting them more in toward the infield. We're taking out the backstop. We're reconfiguring the outfield fencing to 200-foot fencing. Currently, we use temporary fencing year-round, throughout the entire season from spring to fall. And so just the reconfiguration, removal of that fence and addition of the new fence, it didn't seem to make sense to try to reuse 43-year-old fence on this project. I don't know that I said it was completely aesthetic. Obviously, it will look much nicer. And to the point of painting, painting would be a very short-term solution. In addition, it's included in this project. We have $800,000 that we have to utilize to take advantage of this grant opportunity right here so our community can take advantage of this opportunity and invest it into this park and improve some of our aging facilities. So.
Thank you. As far as the condition of the fence is not really corroded that bad. So I've got pictures. I'm going to share these with the public as well, because whenever I was speaking with you on the phone, I was walking around looking at all this, and I've got experience dealing with fence. We've got over probably 3 miles of chain link fence that I guess I'm responsible for. And gosh, if folks even drive by, say, Bridgestone Fire here in town, that fence looks worse than what we're replacing out here at Maxwell Park. And I urge the public to look at this. Now, as far as the cost, it's the same labor to take the fence down, roll it up, and put it back up as it is putting new fence in, as far as the labor goes. So even if you need to move the fence, all you're doing is going to buy new posts, put those in the ground. Labor's the same. We're saving on the material. And as you had said, the material is what has increased the cost of this. So, it just doesn't seem like a need. And I'm sure there's other places where this money could be spent where we're getting more bang for the buck.
But we'd have to find an alternative investment in the park then to meet our mandatory obligation for the grant. So if not the fence, then there have to be something else. And I guess I would argue if we don't put the fence in now and replace the 43-year-old fence with these grant dollars, then at some point down the road, my guess is, I don't know that we can depend on steel prices coming down. So at some point down the road, presumably a fence would need to be replaced. If we take it down, roll it up, and then reinstall it, somewhere down the road, we're going to have to replace it. And then we won't have any grant dollars potentially. It would all be on the town, the town's taxpayers. So I guess we'd have to determine, I guess council can determine which makes more sense, going with the known quantity right now or trying down the road for some better deal.
Have you gotten a bid on what it would take to simply roll back the parts of the fence that you need to do grade work to and unroll it back when you're done? I mean,
No.
Have you requested any of those prices? So then we have nothing to compare with. Now,
no,
Mr.
we don't,
Damery,
because of just the point I just made. Sorry, Mr. Damery, I cut you off.
Yeah, I mean, it was identified as, this field has been identified by the DNR as part of this grant project as a field that's kind of beyond its useful life as far as the fencing is concerned. And so that's one of the reasons why it was rated and approved. And taking this component out potentially impacts some of the grant scoring system that they use to award the grant. And we're not guaranteed that we have a project that's of equal value within that project, within this park, that we could do on tap right now that needs to be done by May 30th. This has always been identified as part of the project. It was approved when we applied for the grant. It was approved when we were moving forward with the project after receiving the grant. And it's always been here along the way. So yeah,
well, things have changed financially, but so then you're saying that the DNR is the ones that have deemed this fence in bad enough condition that it needs replaced.
Well, it was part of our grant application in terms of replacing a 43-year-old fence, and that was approved. So they supported that for the grant award.
And as far as the timeline to get this fixed, Mr. Damery had mentioned that there's other communities in Illinois that are up against the same, you have to use your grant money by a certain date window or you lose it. But there's a state representative that's bringing forward legislation to extend these timelines so that way we don't have to buy at the top of the market if we don't need to. And have you talked with our state rep to see if he would get on board with that to help push this legislation forward? So we're just not simply spending more of the taxpayer dollars than we actually have to.
There are several legislators that are behind that bill, but the timing of it is just not likely to happen in time for us to be able to take advantage of it by the deadline that we have, as many of the other districts that and departments that are in the same position. It's unfortunate, but that's the situation.
And if council supports this and we move forward and finish the Maxwell Park project as planned, as budgeted, and per the grant agreement by the end of May, then the community gets to use the amenities. So there is a benefit to move forward rather than wait in hopes of legislation getting passed.
Well, the fence is not a safety hazard, so it's not like we're taking the fence out. They can't use it. It'd be a lower cost alternative, which would be simply painting or something. But so I don't.
We also
agree
don't
that
know if we lose our grant dollars because we haven't met our grant obligation.
Well, if we lose our grant dollars, then doesn't that mean that the town actually spends less money too?
No.
Mr. Carter, our time has expired. We'll come back to you, Ms. Smith.
So as I'm hearing this, it's an issue of timing of when the grant needs to be completed, May 31st, which is roughly 90 days from today, that the original grant application included a provision for replacing the fencing consistent with the language of the grant application and the program that the DNR was seeking to assist with. And that if we were to modify the grant at this stage, it would be necessary under the guidelines of having eligible businesses participate freely, of drafting an RFP, publishing that, taking in the bids, and then getting the work done. And it sounds to me like 90 days is not enough time for that course of action to be taken. Is that a fair assessment?
That's a very fair assessment.
And absent not going ahead with the fence here, is there anywhere else in the community that fence may be inserted to put in fence that doesn't exist currently, that might be a boon, even though it is 43-year-old fence? What will happen to the fence that we're doing away with?
I would have to check our agreement, but I don't know that if we offered to keep it. I don't know if generally there may be a disposal agreement within the bid, and I don't recall that off the top of my head. So, that would be the only thing that might hang it up, but I don't know why that wouldn't be negotiable.
Okay, so
I think we could keep it if we needed to, if we had another use for it, for sure.
Okay, so that could be explored without jeopardizing the completion of these park facilities to meet the grant, and also to make this site available for people to enjoy this summer, God willing, and the COVID goes away. So, okay, thank you.
Mr. McCarthy.
Thank you, Mayor. I want to kind of bring this conversation back to maybe a little bit more focus if I can. So a couple things. I want to level set on some comments about wants versus needs spending kind of stuff. And I just want to level set that, we're talking about a park here, right? And a park that's been looked at and basically deemed to need some work. And we approved some essentially infrastructure work to make that park function better and continue to serve our residents for many years to come. But spending on parks is spending because we want to have nice places for our children and our families to go. And based on the very high use of this park, it's one of our highest used parks, that the community believes this is a thing worth investing in. And so I just want to level set that with everybody here and everybody watching, is that clearly this is highly valued by the community and it's worthy of investment. I also want to remind everybody, we're talking about cost, that this project was bid out and that people had the opportunity to bid, and staff is recommending the lowest bidder on this project. So we're in fact getting the best available price for this work. And so we're doing the most we can to get the most out of every tax dollar that we can by putting this out for bid, and just to level set the process that this has gone through. We're not just going, hey, anybody want to put up a fence and writing checks willy-nilly. This is a blind open bid process, and staff is recommending the low bid. I also want to comment while we're here is that I'm getting concerned that we have council members beginning to tell operations staffs how to run operations. That is not our role as council members. Our role is twofold. We are policy and we're a budget. And starting to talk about how fencing should be managed or not be managed is really not our role. That's professional staff who's been trained, educated, certified, and has professional experience doing these work and working with vendors and contractors in that area that give them good advice and management. Our role is not to manage vendor contracts. Our role is not to dictate how operations should be run. And so I'd just like to remind everybody that that's our role, and hopefully we can stick to our version of the role. And lastly, this conversation seems to be working really hard to try and turn down grant dollars. And I don't understand why we're doing that. We've got a fancy grant program. We're going to invest $800,000 in a park that people love, and they use a ton. And we got somebody to come in and say, we'll pay half the bill. And we're working really hard to say no. I don't understand that. That makes zero sense to me. We're taking town dollars, we're going out, we're bringing tax dollars back to our community to put them work in a park that people love. And we're trying to say, no, I don't understand that at all. I personally want to save taxpayers money. I personally understand that park is a high value priority for taxpayers, and they use it a ton. So I'm supportive of this project. Thanks.
Mr. Nord.
Thank you. This is $245,000 for those listening for 2 baseball fields. And it's not like we're not spending any money at the park. We're already spending $600,000 there. Now, as far as this being bid out, was this bid on the town's website? Did the town actually bid this out and publish this?
Yes, the town published, and it was actually the project was actually housed at our design firm's plan room. So the announcement sent them to that location.
Okay, because I looked and I could not find the bid on the town website. When Ms. Reese sent it to me, it came from somewhere else. But the other concern that I have is when this was bid out, the local vendor was higher than a vendor coming in from over 120 miles away. And so when I learned this, I contacted someone else that had used this other vendor, because it seems odd for someone to be off that amount of money when they've got to mobilize from so much further away. And what I found out was from St. Charles, Illinois, they have used this vendor over the past number of years. And over the past few years before COVID, they have experienced problems. And, I've shared this with the council that this vendor, they had put up fencing and netting, just like what the town proposes to use. And there were 8-inch gaps where a ball could go through. And they had completion issues, with being able to complete on the set timeline. They said that the quality of material was different than what was bid out. And, they had said that this was the St. Charles assistant superintendent of their schools, their park district. and their fencing inspector all had concerns. So, I want to make sure that if we're going to do this, and the vendor is going to be coming from that far away, that we're not putting our taxpayers at risk because we want to get this done so bad at whatever cost that it may end up costing our taxpayers more money in rework and extra supervision fees and delays and things like that. So I'm not going to tell you how to manage that, but that is a real concern that I have. And it's much different when the vendor, you can drive to their office because they're local versus they're really far away. How are you going to manage this issue that was brought up by another municipality?
Yeah, the issue after we opened bids and the other bidder or the other vendor saw who was low bid, they made us aware of the St. Charles project. I know some individuals up at St. Charles Park District. I made a call and I talked to them about those issues. There were some workmanship issues and some scheduling issues. All of the other references that came back from Hitchcock came back with very positive reviews. I actually know a couple of people in those that were attached to those projects as well. And I personally gave them a call, different than the references that were, excuse me, originally contacted. And they had no issues at all. So I don't know if this was a one-off or just a timing issue or a scheduling issue at the time when the St. Charles project was getting done. But everybody else has had a very positive experience with them, are happy with the results. And I even called Northern Illinois Fence today and I said, what insurance do I have that we're going to get a quality project? And they have done some reorganization over the last 18 months. And the individuals that were with that project are not unrelated to these issues that you're referring to are no longer with that company. So I'm hopeful that we're on a better path with that organization than maybe St. Charles was. And also I think we're going into it with our eyes open. So we will be making sure that the workmanship and the schedule and everything along with that the concerned St. Charles will be taken care of on site before they leave. So.
Right. And Mr. Damery, if you could also mention, or I guess I'll mention that staff will be on site and overseeing the work. And so we'll certainly be aware of concerns that we heard from this particular vendor and this one client of theirs, but we also know that we've received a number of positive comments as well from their work. So, but we'll monitor.
Okay, my concern still is that this is 50% over budget. I'm sure there's other places we could use this money. And at what point does the project increase in cost so much for something that's more cosmetic, where staff believes that it's just going to cost taxpayers too much and we're not going to go forward?
I assume that's a rhetorical question because I don't have a specific answer for that.
Okay, and that would be the council's decision as to when it's too much, is that right?
Ultimately, yes.
All right, and it'll be the council's going to be accountable for the expense, for any problems, for anything else that goes on with this project?
Well, directly in terms of any problems, I assume if you mean trying to get, if we run into a problem with the vendor, I don't know what you mean in terms of problems with this project, but staff will deal with daily operational issues like we always do if there's a problem with a vendor or a project. Council can certainly direct us to do otherwise, or can disagree with us and believe that this investment is not worthwhile and direct us to do what we can to preserve our state grant, and we will respond accordingly. But we're coming in with a recommendation that we think is very solid.
Okay, then I have a question for my council peers. Is there any interest in getting an estimate to paint this fence and try and get another 30 years out of it before we have to replace it? If there is, I'd be happy to hear. I see there's other hands up, but thank you.
Mr. McCarthy.
Okay, just a couple of things. I just want to remind, maybe Mr. Nord forgot this, but this is an all or nothing matching grant that we applied for. We applied for 800,000 and 400,000 matching. We can't take some of it now and say we'll spend some of it and get some of it. It's either we do what we said we were going to do in the application, or we don't get the matching grants. It's not an all or nothing. Again, I want to draw the attention that we've got a member who's calling up other communities without talking to staff about that on bidders in a open, fair, blind bidding process. And that's not our role. That's staff's role. And what's even more concerning is that that's happening based on information being provided by an unsuccessful bidder. That casts doubt and undermines the integrity of our procurement policy and starts to throw shade on whether or not there's backroom dealings going on between bidders and council members. I implore you, Mr. Nord, to please stop doing that. Our procurement policies are in place for a reason, and council remains at arm's length from those relationships for a reason. So we don't cast and undermine the public's confidence. Please stop undermining public confidence by working with unsuccessful bidders and coming back to this council and trying to do their bidding after they're unsuccessful. I don't want any type of impropriety or even the hint of that type of shade being thrown on this council. So please, I implore you, please work with us on the policy side and stay out of operations, please.
I've got a bunch of hands up, so I'm just going to caution us not to get circular on this and keep going over the same issue again and again. We can just go to a vote, but I'm certainly not going to discourage you from making a comment if you wish. Ms. Smith.
I simply want to make the point that in terms of cost controls, this is a fixed price bid that will not change unless the vendor comes and identifies some unforeseen contingencies, which normally don't happen in a fence contract, but are quite a frequent occurrence in remodeling. Is that a fair statement? Yes. And it is my understanding that despite the distance of the winning company from Normal, that the town staff that will be overseeing the progress of this project is here locally and will be involved in the oversight as the project progresses. And I also know from my review of the expense reports that we hold on to money until satisfied that the contract is complete according to specs. Because I did see a payment in a recent expense report, and when I asked about it, was informed that that was the final release of funds for this project that the council had approved months earlier. So there are methods in place to ensure that the town is not stiffed when it comes to paying for work that we didn't authorize, and making sure that vendors hold their part of the agreement up. And so I'm thrilled that there were as many responding to the bid as came in, because it was several contractors, and this winning bid was quite attractive compared to the range of pricing that came in. So I'm all in favor of this. Thank you.
And Mr. Nord, you've got your hand up, but you've had your 2 10-minute sessions on this issue. Ms. Honker, please call the roll.
Mr. Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
No.
Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mayor Kus.
Aye. The resolution is approved. Item H is a resolution to accept bids and award a contract to Stark Excavating Incorporated for the Towanda Avenue Bridge Repair Project in the amount of $982,644.20 and approve a supplemental resolution to appropriate $180,000 of motor fuel tax funds for the Towanda Avenue Bridge Repair Project. Motion for approval.
I so move.
Second.
Mr. Nord?
Okay. First, I want to put out there, I ask council members not to assume and put out in the public where I get my information or who I get my information.
Mr. Nord,
because
would you drop
it
that
is-
issue? And that is not the issue we're talking. You're
Well,
trying.
this has to do with the Towanda
Mr. Nord, you
Avenue
were trying to
repair.
get here. You had your two 10-minute sessions. If you have an issue with Mr. McCarthy's comments, reach out to Mr. McCarthy and have that discussion. We are here to talk about Stark Excavating, and we're limiting the conversation to that issue.
Okay. Well, this project is now 260% over budget, what it was originally estimated at. So my question is, with all this extra money we're spending for it, what projects has the funding been pulled away from that were planned?
Thank you, Mr. Nord. I'll ask Mr. Otto to again join us. He's got a number of projects on the agenda this evening. The Towanda Avenue Bridge is something that we've talked to council about because not too long ago you adopted a resolution to allocate motor fuel tax dollars. And just to be clear, what we're talking about is our motor fuel tax dollars. This is a MFT funded project. Those are dollars we receive from the state. Mr. Otto, if you could explain the project.
Sure. Thank you, Ms. Reese. There are no projects that are planned that this money would essentially cancel. The money, the additional 180,000 comes from motor fuel tax balance. That's a fund we carry some significant fund balance in for contingencies, just like this when we have a bid that comes in over budget. The bid came in over budget for several reasons, we think. One is it's hard to estimate the type of work that we're talking about. It's very unique. In other words, the work that we're doing, we're taking, essentially knocking a hole in the bridge deck and building it back up. So we're looking for deteriorated concrete. We are working in a creek with difficult access. There's just a lot of unique aspects of this project. So we think that contributed to it. It's on a main route with a lot of traffic. It has lots of unique items, as I mentioned, and then the one bidder situation where we think the complexity of the project just lent itself to a local bidder. So I don't necessarily have hard answers to why it came in over budget, and other than it's just hard to estimate this type of project for a lot of reasons.
Sure. This is $603,000 over what was budgeted last year. And you're saying that there's no project that $603,000 was allocated for over the past 5-year budget?
There is you look at the contingencies for all of our MFT projects, that's in the millions. So we carry, again, a significant amount of money rolling over from year to year for that. Certainly it will preclude us from doing other projects in future years. That's money, that's real money that we're spending. And so that reduces those funds, the funds that are available for, future resurfacing programs, future bridge projects. Certainly we'll want to take a close look over time and make sure we have the fund balances to cover other contingencies. But if you look at the CIP that essentially is before you tonight and was approved back in December, we're not planning to delay or change any of the projects that were presented in that.
Well, I'm saying compared to last year's budget and 5-year plan, versus this year. The $603, like you said, it's real dollars. What project got dropped off of last year's 5-year plan or projects to account for this?
There wasn't any specific allocation of these dollars. In fact, you know, in a future agenda item, you're going to be adopting our budget, and we try to maintain a fund balance in the motor fuel tax fund. And, you know, not every project comes in under budget, not every project comes in over budget. I think when we asked council back in earlier this calendar year to adopt the resolution to allocate motor fuel tax funds toward this project, I believe we explained that the project has become very complex, more so than we had originally anticipated. So I certainly understand your concern about wanting to preserve motor fuel tax dollars. The reality is replacing or repairing the Towanda Avenue Bridge is significant. And so if, you know, I don't know what the end game would be in this conversation, to either reject bids and redesign it and try to do something else, which certainly could be an option. No guarantee that's going to save any money, but we'll have to assess as we have motor fuel tax information, what future projects will be on the list. Every year, the engineering department is doing a thorough assessment of our road pavement needs and projects that qualify for MFT funding. Not every road project qualifies for motor fuel tax funding. These are state dollars. So
Yes.
Mr. Otto will assess this on an ongoing basis.
I'm not questioning that this is an expensive project. There's a cause and effect. You know, money's taken, we're going to spend more money here. Where is it coming from? And what are we sacrificing? So that way we know whenever it happens. I mean, it's a legitimate question.
It
So
certainly is a legitimate
I think this
question.
needs to be rebid out or anything. I understand, you know,
I think
costs
what-
go up, but this is a 260,000 or 260% increase, 2.6 times more. And you typically hear about government projects that, you know, are multiples over budget. And this is multiples over budget. And,
sure,
you know, I think we need to look at our estimating and kind of do it like a lessons learned from this. So we don't have these again, because we've had stuff in the water department here this past year that was over budget by a huge amount of money too. So hopefully this kind of balances out. But
And we had a number that were under budget as well. I mean, we've had it both ways. I hear what you're saying in this particular instance, like every year and like on an ongoing basis, Mr. Otto, when he comes in with the capital investment plan in the fall, will say, here's the projects that we think the motor fuel tax fund can support. And we'll have that list, and then we'll also have maybe some unfunded projects that we would like to do with the motor fuel tax, but it will be dependent on the dollars that we believe we will be receiving from the state.
sure. And then my last request is if you could maybe reach out to the contractor that we're going to be approving, I assume, and see if this is because of the increase in steel prices or something, because this has me worried about other projects that we have that may be under budgeted now, that costs have gone up, and we may have to quickly reassess the projects because we may not have, because we might be looking at increases on a lot of projects.
Sure.
You know, I'm sure
We
there's a
absolutely-
significant amount of steel going into this, and steel prices change weekly. I mean, I deal with this every week.
Right. There's a
But
lot of
thank you.
expertise that's going into this project, so we certainly will see what the driving factor was on the price.
Ms. Smith.
Yes, and if it might be helpful.
Could you lower your hand?
Oh,
Thank
you don't trust me, huh? Oh, you were talking to him.
Yeah.
It might be helpful if the staff could reach out to Bloomington and find out what they spent at this intersection, because they've already improved the southern edge, adding a turn lane. Very much appreciate it for the traffic pattern, but they weren't over a creek. But I believe that was quite an expensive project. To give us some context, and if you could share that with council,
I suspect, and sorry to interrupt, Ms. Smith, I suspect Mr. Otto may have a pretty good indication since he formerly was with the city of Bloomington. And,
okay.
it was a great project. I very much appreciate that improved intersections.
Yeah, thank you. Thank you, Ms. Reese. I was involved in that project pretty heavily in my former role with the city of Bloomington. I don't recall the exact number. I want to say, don't quote me on, but I think it was around $1 million. But it included the turn lane, all the resurfacing at the intersection, replacing the entire signal system. The project was actually a joint effort, interesting to note, between the city and the town. The town contributed to that because we own essentially what is the north leg of that intersection. So the town was involved in pavement patching and the planning and contributed financially as well to the project. So that's correct. Yeah,
okay.
It was definitely a significant investment by the city of Bloomington.
And then in response to a query I had about how much paving would be involved, improved paving in this intersection upgrade, I was given a figure of 40 feet. Can you put that in car lengths? Because I cannot visualize 40 feet without it being part of a city block and counting houses.
Sure, be glad to. I'd say between 2 and 3 car lengths, so not very far. The south half or the south approach is asphalt, so we're going to be milling that off and redoing it. The north approach area, when you get north of the bridge, is concrete. Some of that has to come out to put in some new drainage structures that we need to help drain the area. So that'll be put back in concrete because of the patching we have to do anyway in that area. So it's probably 2 to 3 car lengths.
Okay, thank you.
You're welcome.
Please call the roll.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
Aye.
Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mayor Kus.
Aye. The resolution is approved. Item I is a resolution authorizing the execution of a local public agency agreement for federal participation with the Illinois Department of Transportation to use $1,080,000 in federal urban surface transportation program funds for phase 1 and phase 2 design services. And that's for West College Avenue from Rivian Motorway to White Oak Road. Mr. Nord?
I so move.
Second.
Mr. Nord?
Thank you. Ms. Reese, you had sent me an email about the total amount of design expense that we're going to have on this road that's been approved so far. It was this 1,000, or it was this 1,080,000 plus what was the other number?
I'm not sure. I can pull up the email and take a look. In the meantime, I'm going to say, Mr. Otto, come back and join us. He's been living this, so he might, off the top of his head, have the answer to that question.
I do. Thank you, Ms. Reese. There are $370,000 in local funds dedicated for design of this project.
Okay, so that means we're going to have $1.45 million in design alone for this. And what is the reason why we just can't reuse the plans when this was built?
So the plans that that were done for the road, a couple of reasons. One, the federal funding requires a full phase 1 and phase 2 project that we're using. Another reason is we are experiencing significant drainage issues. One of the reasons the road has deteriorated with the age that it has is significant drainage that we need to address in the area. So we need to take a look at that. There's a lot of needs potentially with future, the exciting things that are happening now at Rivian. We want to take a look at traffic. The needs have changed since it was built in the late 80s. So we're going to take a look at traffic volumes, intersection designs, working with the state of Illinois to look at the intersection design studies that we're going to do at Rivian Motorway, Wiley Drive, as well as the county down at White Oak Road. So we're going to take a look at all those things, look at multimodal improvements, and generally just take a close and fresh look at the design of the roadway to make sure that it can function better for the future.
When was this road surface last rebuilt? Is this the original surface?
Yes, sir. It is the original surface from when it was built. I want to say late 80s. I don't remember the exact date, but it was put in mid to late
Sure.
80s with the original
Yeah.
Diamond Star plant.
Yep. That was the late 80s. I remember that. So yeah, I mean, so this surface has lasted a whole lot of time. So even with all those issues, this has lasted longer than most of the roads in normal. So, you know, it just seems like we're spending a whole lot of money on design, and, you know, that road is horrible. I would say this has got to be one of the worst roads we have in our community. And, you know, all these other amenities that we want to do to this is just delaying getting the work done. Later tonight, we're going to be talking about the MFT resurfacing. That's 170 or $1.7 million for 1.7 miles of work. And just for this road alone, we're spending close to that for just for design alone. You know, none of that's even going into putting pavement in the ground. So it's like I don't even know what we're designing, which brings me to my next question. All these amenities you're talking about, apparently the designers know what their end goal is that they're designing for. Can you tell the council and the taxpayers what this end goal is that all this design money is being spent for and why it's as high as it is? Do you have some sort of picture? It doesn't have to be, you know,
Well,
even all that accurate, just something.
Before Mr. Otto jumps in, I guess I'm not sure what you mean by, you said all these amenities we're designing, and I'm not sure what you mean by amenities. Basically, Mr. Otto has indicated the design is addressing drainage issues. There includes some intersection design study that the needs have changed. And frankly, we all know there's growth in economic development that is happening now and on the horizon, and we are preparing for that. But there's significant improvement that needs to be made to the pavement. So maybe you can clarify in terms of what you mean by amenities, and we can respond to that.
Well, the significant improvement to the pavement is putting new pavement down. It's all the design outside of using the existing plans that I would like to know about. So show us what is different that's being designed. He mentioned the trail, at least I assume that's what the reference was. I know I've heard about trees and other things before, you know, anything other than actual pavement that vehicles drive on. What are all those things?
Well, we covered this a couple of times when council originally, when we went to council, I think it was in July of 2020. Actually, it was last summer. So, Mr. Otto, do you want to give another summary of what the project entails?
Sure, be glad to.
Actually, I think it was May. I'm sorry, it was May of 2020.
Thank you, Ms. Reese. The project is, again, a complete rebuild of the project. So we're taking a look at pavement design to look at the updated traffic loading, truck loading, take a look at multimodal needs. You mentioned the trail. That's one possibility that we're going to look at. Right now, preliminarily, we're looking at a trail on the north side of College Avenue from White Oak over to Rivian Motorway. The other amenities may be subject to change. Certainly, we are going to do a robust public involvement process and have the community involved in public meetings for that. So we'll take a look at any other needs that might be brought forward as part of that or concerns. We'll be meeting with all the property owners, the business owners out there as part of the design process to see if there's need for turn lanes, for instance, for a particular business or an area that might have heavier truck traffic than when the road would, excuse me, when the road was originally designed. So we're taking a look at all things. We're opening it up to look at turn lanes for various intersections. I'm sorry, I don't want to talk too much. Am I answering your question?
It would be nice to see some drawing, some sort of visual, anything, even if it's with with crayon on a napkin, so that way, taxpayers can see what this investment is for, because at the end of the day, this is one of the worst roads, and it's not, and all this design and engineering is costing more than just simply fixing what's there, and it's pushing this out until at least 2023. And taxpayers are paying for all this, and we have to drive on this horrible road, and we just want to get our road fixed. The amenities, I haven't heard anybody from the public say we need all of these other things. And we're spending more just on design, and it just seems like we have to pay for the design to see what our end goal is. And if we can't afford the end goal, then now we're spending all this money on designing something that we can't afford. And then that money is going to be essentially tossed out the window because we can't afford to do this big grand promenade that I've got in my head that we're going to do.
Yeah, certainly the design cost. I mean, it's a significant cost. It is certainly within standards for what we see for these types of projects. I would not have recommended it if it had been out of line. We went through the full QBS negotiation process to pick the consultant. We negotiated a contract per that federal process, and what we ended up with, I'm confident, is reasonable for the scope and effort that's going to be required to design the project.
Okay, I'll put my hand down. Thank you.
You're welcome.
Mr. McCarthy?
Thank you very much. I, for one, want to say I'm extremely excited about this project. I was out this weekend talking to citizens, and I had two citizens specifically say to me how excited they are that we are addressing College Avenue and getting it done. I presume this is a question probably for you, Mr. Otto. But so there's a lot of time being spent on the investment in engineering as if that has no value. Maybe you can help us cement that. Is the investment in engineering, let me put it this way, I guess, is the investment in engineering to design for current conditions, uses, materials, part of what will improve the functionality and the useful life of this road?
Yes, we're going to take a look at not only existing conditions, but try to project out 20 to 30 years to look at pavement design. So for instance, if we're projecting additional truck traffic in that area based on projected growth, the pavement the thickness of the pavement has a big factor in how much this thing costs. So we want to design that pavement so it's going to last a long time. The existing road has lasted a long time. However, it has not been in good condition for some time. So to say that it's lasted, until now is not probably not the best characterization of the condition of the pavement. So we know we need to get it fixed. It's in rough shape. Our public works crews are going to do their best to patch things up and try to get it through to construction. They're very much aware of it and are going to work to make sure we can get it through to when we can improve the entire road. So, but the design process has value to look at everything again, try to make sure it meets our needs for the 30-year horizon.
Yeah, I was making that assumption, but nobody had really asked that question. So thank you. I assume that we're investing in engineering to make sure that, and I agree, this didn't last 30 years from a guy who's hurt some rims and popped some tires out there on my bicycle. We want to do as much upfront planning and engineering that's going to get us a long-term useful life. So I assume that would be your answer, but nobody had asked the question. Also, can staff, I don't know if this is for you, Mr. Otto, Ms. Reese, or Mr. Yoon, or exactly who this question is for, but can you remind us how much grant money that this project we're anticipating we're going to get?
Known grant funds are in the neighborhood of around right now around $3 million. Again, we have a $5 million DCO public infrastructure grant that we've applied for. We've been told that that announcement should come in second quarter of 2021. So potentially there's around $8 million in grant funding for the project. 3 million, like I said, 3 million is known at this time and secured.
Okay, so for not quite a $10 million project, that's supporting some amazingly substantial economic development in our community. We're going to pay probably less than 20% of the project locally.
That's the hope. That's the hope, yes.
Yeah, I get it. I know that's not signed and sealed and delivered, but I appreciate that all the work that's going into this from the engineering design perspective, certainly, but also all the work to go out and bring money back to our community to work right here and to keep our costs as low as possible on a project like this. And so I just wanted to level set and reminder we're throwing a lot around millions like they're dollars. But I just wanted to remind everybody that the goal here of financing and funding is that we're going out and trying to bring tax dollars back here to keep the cost as efficient and as effective for taxpayers as possible. Thank you.
Ms. Smith.
So to clarify, are we increasing the number of lanes on the road in any way other than for potential turn lanes?
No, that's an excellent question. It's unknown at this time. We're going to take a look at all the traffic volumes, projections to see what the need will be in the future. So I guess I don't know at this time. We're early on the design process. We've just completed data acquisition and surveying. And so we're right now, the design process is actually a little bit on hold while we wait on our federal design contract to be approved by the Springfield IDOT office. So as soon as we are able to start getting going on the major design where we're looking at the traffic volumes and things like that, we'll have a little better idea and be able to present that when it's available and when we determine the volumes and the truck loading and things like that.
And you'll have to be taking some soil samples to ascertain what is contributing to the drainage issues, and that cost is included in this design phase. Is that correct?
Yes, ma'am.
And once the design is completed, the design phase is going to incorporate the conversations with the public for feedback on the various proposals. Is that part of this design cost?
That's correct, yes.
Okay, so what we have involved here is not just replacing the road that it is, but fixing underlying problems, doing studies to make sure we know what we're dealing with into the future, and creating ultimately workable plans. And that's where the cost is. But the purpose of tonight's meeting is primarily formalizing a resolution to use the federal funds at this time for this project for grant money that has already been awarded to us. Ms. Reese, is that accurate?
That is accurate.
Okay, just wanted to get that on the record. Thank you.
Mr. Norton.
Thank you. So you mentioned this is going to address the intersection at College Avenue and White Oak Road. Is that going to be a truck route? Is that why you're looking at that intersection as well?
Well, we have to have logical termini. So we'll look at the intersection itself. We don't anticipate major changes to that. There may be some signalization changes based on updated standards for traffic signals and interconnects with the railroad crossing that's fairly close. But we don't anticipate major changes to that.
And what about the trail crossing right there? What's the idea there?
So that'll be looked at as well. That'll involve a work with the ICC and Norfolk Southern to take a look at. It'll probably involve pedestrian signals similar to other crossings on Norfolk Southern. When I was in my previous position with the city of Bloomington, I was involved in the West Washington crossing of Norfolk Southern. So I anticipated it would be a similar process, and that has pedestrian gates, things like that for the at-grade crossing.
But again,
Well,
that
I
hasn't
mean-
been designed yet. So that's in the concept phase in terms of how that fits into the whole project.
Correct.
What about crossing White Oak Road?
We would look at that as well. That'll be involved in the IDS as well, yes. So we'd look at that too.
And
Try to
IDS
go-
is intersection design study.
Okay, because in Bloomington, they've got problems with folks crossing Veterans Parkway, which is another 45-mile-an-hour road. And, now they're talking about putting a big bridge structure out there or something, because we've had deaths going across there. White Oak Road is 45 mile an hour right there. What are you looking at to fix this? And is this in this design study? Are we talking another structure?
Well, Mr. Nor, if I could say that the design hasn't occurred yet. We're in the design phase right now. So we really can't articulate specifically what it's going to be and what it's going to look like. The item at hand here is just authorizing the $1.08 million of federal funds toward this project.
Towards design for this
Correct.
project alone.
Right.
Yeah, so I am all for fixing College Avenue and getting that fixed quickly, because economic development's not going to utilize that road until it's fixed. They're not going to appreciate it. And it's an embarrassment in our community for it to go on for another 2 years. It's an embarrassment that has been there for as long as it has. So I'm for fixing the road, but I'm not for all of these other things delaying fixing that road. And that's why I just don't support using this money for the design, because we have to design it before we know what our end goal is. And it's just going to delay fixing College Avenue. But thank you.
Mrs. Lorenz.
Thank you. I kind of reflect listening on this part of the conversation and to tying it to themes from previous items. I think it's a question here that our fellow councilman, Mr. Nord, is kind of steering us away from utilizing grant dollars, which would be involved with this. And I think he's also indicating that he's steering us away from doing full engineering and design work. And that's not a path I want to go down. I think as a council, as a town, we should strive for higher standards than just slapping something together, crayons on the back of a napkin. So I would really urge us to, our taxpayers deserve well-designed, thought out infrastructure, and to the best of our ability to seek out matching or somehow leverage grant dollars. So I don't want us to lose sight of that. Thank you.
Please call the roll.
Ms. Cummings,
Aye.
Mr. Nord,
No.
Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Mayor Kus.
Aye, the resolution is approved. Item J is a resolution to appropriate $1.73 million of motor fuel tax funds for the resurfacing of various streets for the 2021 MFT street resurfacing project, and authorize the town engineers to sign the IDOT general maintenance form. Mr. Nord.
I so move.
Second.
Go ahead, Mr. Nord.
Are we able to use grant money for resurfacing roads?
Mr. Nord, in fact, I'm going to ask Mr. Otto to come back on the call. He's had a number of items on the agenda. So in terms of, let me just explain what this is. This is one of our resurfacing contracts. This one pertains to using motor fuel tax dollars. As I mentioned earlier, motor fuel tax dollars are the state funds. So these would be the state dollars towards resurfacing. Mr. Otto, do you have a comment regarding whether or not we can use grant funds?
Yeah, thank you, Mr. Reese. The short answer is no. I'm not aware of grant funding to fund what is generally considered as maintenance. Grant funding is typically for larger capital projects that are more involved. So resurfacing is typically not eligible for the types of programs that grant funding comes down for.
So if we had a mile worth of road to resurface, we could not apply for a grant?
I'm not aware of grants. In fact, the Rebuild Illinois money that we get paid into our motor fuel tax account from last year, you might recall we've discussed that a couple times. We can't even use that in generally for overlays. The state does consider that type of MFT funding as a functional overlay if it's more than 2 inches. And there's some times where we're not doing 2 inches to save money on local roads and things like that. So even in some areas, we can't use that type of MFT funding for resurfacing.
Okay, so for the roads that are included in this MFT resurfacing, can you explain how it was determined that these were the roads that were going to be fixed? What type of citizen inclusion was used and council inclusion to prioritize these over others?
Sure. So we have a 1 to 5 rating system currently for our streets. It's a bit antiquated, but it's a starting point that we use. We take priority 1 streets, for instance. Myself and several members of my staff scout those areas out. We drive them. We take a look at other streets in a given segment of the town to try to group the roads together to get better bid pricing. We look at the lengths of the segments to make sure that we're not just giving smaller segments when we don't have to. If we can do a larger section, we typically get a better bid price for a longer stretch. We look at any underlying utility needs, that maybe an area that has utilities that have already been fixed in terms of sewer and water, to take a look at those to make sure those are not going to be an issue. Either they've been done or they will be done. So we might skip that area, even though the road's in maybe slightly worse condition than another one. We also look at traffic levels. We want to make sure we're taking care of our arterials, but not ignoring our residentials. So it's kind of a balance that we look at. We also look at something that's a little more subjective, which is deterioration rate. That's something where we have staff experience and looking at a road that we know has been good maybe for a while, but maybe in the past 5 years, it's gone downhill quickly. We see that in particular with a lot of our concrete streets that we're trying to get a handle on, because once they reach a certain point, kind of like College Avenue, they reach a certain point that it's not really feasible to do a mill and overlay anymore. It's a reconstruction. So we want to get on those prior to that level of condition. So we're looking at that as an opportunity to make our dollars and the life cycle costs go down for that. And then we're also looking at cost. So what fits in our program. Maybe there's a length of road that's too long to fit in the program for this year, because we have other streets that we've identified that have a larger cost, for instance, and it just doesn't fit. So it might be more cost effective to do, instead of doing half of a stretch, maybe we push it to next year. So we're looking at a lot of different factors to try to come up with the best possible use of our resurfacing dollars.
If I could also jump in, Mr. Otto and Councilmember Nord, the council might recall that we have partnered with McLean County Regional Planning to do a pavement assessment rating. And so that will be used by Mr. Otto and his team moving forward. And so generally, most of the prioritization of our projects is based on data and objective criteria with some subjective component. Certainly, if citizens are aware of or have concerns about particular pavement or roadway, they need to bring it to our attention, and we will certainly take a look. And Mr. Otto is always open to go out and take a look and find out the condition of the street.
So the 1 to 5 rating system that was not rated by condition of street, that's a different rating for something? Is that right?
No, that's an in-house rating system that the town has used for many years. So it involved just going out, driving the streets, assigning a prioritization level. The kind of the difficult part of it is we have probably 40 some miles or 40
Yeah.
some miles.
Excuse me. We're getting into something else that I really wasn't asking. It's the streets that we're doing in this MFT resurfacing tonight. Are all these one of the lowest rated streets, or any of these ones that
could be delayed, you mean?
That could be delayed so we can take care of other lower rated streets? I mean, do you guys do that calculation? Because this never came before because I was never asked what the priorities were or asked what I thought the priorities were. And this would just be a question.
Right.
The worst streets should get addressed first.
Yeah, we don't actually use a worst first approach because we look at things I mentioned, the rate of deterioration. If you use a worst first, that's not best practice in general, is to do your worst first streets. I know it's a little counterintuitive, but we're looking at life cycle costs, for instance. We want to get on pavements quickly that have a rapid deterioration before we have to rebuild them. Rab Road that we have before you tonight is one of those, along with Gregory Street. We think that those joints are deteriorating rapidly, and if we don't cover them up, we could be looking at a situation where we have to do either very extensive and expensive concrete pavement patching or complete reconstruction, which is also very expensive. So we try to get the areas of the roadways that are not in good shape. We want everything to be serviceable, or we work with Public Works to do some spot patching. But I guess it's not exactly what we do to say that we do worst first, but in general.
Also, I want to point out that this is also the first contract for resurfacing. There is a second one coming along, and that will be coming yet this spring.
Okay, then my last comment, I think, for this is, whatever the process is, I would like to see that it ensures that we never have a street that looks as bad as College Avenue. Because for the next 2 years, I'm going to hound the town and compare College Avenue to everything else out there until it's fixed, because it's horrible and we're delaying fixing it for at least 2 years. But thank you.
Ms. Lorenz.
There we go. I want to just raise up the fact that I think a section here in the Savannah Green area is being addressed, and I would like to ask Mr. Otto to speak to that. There's been a number of residents who have spoken about that area. We talked about it during budget. Is that, I think it's in green, so is that getting a rebuild, or tell me a little bit about that so I can pass that along to residents there, and Ms. Cummings being one of them.
Absolutely, yeah, I'd be glad to talk about that. Public Works plans to do pavement patching in that area. So the streets, the primary deterioration mode we see in Savannah Green is base failure. One of the hard things to address about that is it's not typically a mill and overlay approach, because if we mill and overlay, the base is bad and it's not going to last very long. So what we're proposing there is to go and do some pavement patching in areas. There's broken pavement in alleys and in approaches. We plan to utilize Public Works crews to remove those bad areas and replace them on those streets.
So will this address some of the alleyways too that are used for access to garages and so forth?
Yes, I believe there will be some patching in the alley areas.
Okay. All right. Well, hey, that is an example, and of from what I understand from you, Mr. Otto, and others, of unfortunately it was the developer in this case, of not putting the design time and the engineering into the roads. And so if we are too hasty on just slapping down roads without proper design and engineering, that's what we can get. So I might argue that some of those roads are the worst in town, sadly, that have now fallen into our lap. But thank you for being on it. Thank you.
You're welcome.
Mr. McCarthy?
Thank you, Mayor. I just want to correct a statement and reiterate some of what several people have said, is that we're not delaying work on College Avenue. Town staff is doing, in fact, what Ms. Lorenz suggested, which is they're doing the behind the scenes work of design and engineering so that we get the best possible use and useful life from this project, so we can get the most that we possibly can for each and every tax dollar that's involved. And that's what we're doing. We're being careful, thoughtful planning to make sure that we get the best outcome possible for tax dollars. Thanks. I'm supportive.
Please call the roll.
Mr. Nord,
Aye.
Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mayor Kus.
Aye, the resolution is approved. That concludes our omnibus agenda. Yeah, I heard that. We have two items of general orders. The first is an ordinance adopting the operating and capital investment budget for the town of Normal for fiscal year 2021-22.
Move approval.
Second.
Thank you. Is there discussion on this? Mr. Nord.
Thank you. I feel a little guilty going first so many times tonight. But for this, we had a couple-day meeting on this, and there were lots of different comments that folks asked for changes. A couple that I have is there's money that's being moved from the general fund to the vehicle replacement fund. And we were told that this was going to be used to pay off existing debt here in like 14 months. Is that still shown in this budget, that that money's going to be used to pay off that existing debt? I believe it was like roughly $8 million.
Mr. Hune, Finance Director, Mr. Hune can talk about that specific transfer. We reviewed this with council, and thank you for bringing it up, Mr. Nord, in terms of our debt restructure plan. The first step of the debt restructure was selling, refunding bonds, which council did authorize last month. And then we said the next step in a multi-step process would be to take some funds this year, transfer it from general fund to two different locations, to other funds, to other pots, and then use those dollars in 2022 when some bonds are callable. And so, Mr. Hune, can you explain the transfer that we've made?
Certainly. We made a total transfer before the end of this fiscal year of $8.2 million. $4 million of that money went over to our debt service project reserve fund. And that money is being held there to be used to satisfy the debt payoff that City Manager Reese mentioned in 22-23. There will be additional $4 million pulled from, or $4.2 million pulled from general fund in 22-23 to pay off the $8.2 million of debt that we're going to pay off in that year. We did move money also, $4.9 million to the vehicle and equipment reserve fund. That money has been essentially set aside as additional contingency, if you will, for the out year budgeting. We are being fairly conservative in the out years. We are seeing some deficits that may materialize depending on how fast COVID eliminates or how fast how we get to a post-COVID economy. We assume not to get back too quickly, so we set aside more reserves to kind of balance the budget in those years. But in the basic transaction is $4 million from general fund right now is being set aside, And then 4.2 will be set aside in 2023 to pay off the $8.2 million debt that we planned.
Okay, good. And then is there any money in this 5-year budget that's being shown for, or being allocated for phase 2 or any construction costs or further costs for the underpass?
Mr. Nord, I think I've addressed that a few times. The answer is still the same. The only thing that's in this budget is funding for our phase 1 commitment. When we have, funds that we show to be allocated and directed towards the phase 1. We're currently in phase 1 design. At the point where we would secure funds to cover further steps of the process, then we will come back and amend the budget accordingly.
Okay, so for 5 years, all the money that we have is allocated for something other than the underpass.
I think that was just answered.
Well, is the answer yes? Because I'm just clarifying.
I'm not sure I understand the question. All the money we have is allocated for something. I'm not sure I'm
for
clear
something
on
other than the
understand
underpass. Okay, I just want to make
For
sure that
lots
it's
of things.
allocated for something other than the
municipal
underpass.
operations and all sorts of capital projects.
Okay, then are we also proceeding forward with the $4.75 million for the water extension out along College Avenue and then in front of Rivian? Is that still in the budget?
That is still reflected in the budget, yes. And as I've indicated before, certainly if we don't spend it, that'd be great, because that means we receive grant dollars to pay for it. But right now we are planning as if we don't have any grant funds. If we find a grant opportunity that we could apply for, we'll do our best to seek grant funds for it. Very similar to the Oak Street project that we received grant funds for this year. So when we have shovel-ready projects, it sets us up for pretty good success in seeking grant funding.
Okay, whenever this first came before the council, I asked if a business had asked the town to extend service, or if any business had complained about the quality of their existing water, and your response was no.
That's true. I
Is that
did say
still accurate?
that is still accurate. And to explain what that project is that you're referencing, the $4.75 or so million that we do include in the budget is to complete a loop. We currently have a dead end water main on Electric Avenue. And so it would loop the water main back to the current terminus on College Avenue. And also sets us up to be able to serve future economic development out there.
Sure, and that loop has existed for well over 35 years, or that there's two dead ends have. And
yeah.
We've got locations, well, I guess I'm not gonna get you to change the budget tonight, but just wanted to point this out. We've got locations in town where there are neighborhoods that are getting rusty water. Even the mayor commented that when they flush his pipes in his neighborhood, that he's got rusty water for a couple hours. So this is now, pipes in the ground corrode, and they will need to be replaced. And I would rather see the money allocated towards those projects where we know there's a problem, and delay putting something in when it's just speculative, where we've got no business that has requested this. So for that, I'm not going to support this. I don't expect that this is going to be removed tonight. I just want to get this on the public record, as this is one reason why I'm not going to support this budget. Another question that I have for you is the underpass. We have told the federal government and the railroad that the town is fully committed to allocate current capital and debt financing of $7.38 million towards the underpass. So if that money is not identified anywhere in the 5-year budget, and we've already allocated this $8 million to pay off debt here shortly, then where is the $7.38 million accounted for in the next 5 years?
It
Where is
isn't
it going to
yet.
come from?
It isn't yet, Mr. Nord. That's why I indicated that we don't show the project because we haven't secured the funding to fill that gap. The town has not executed the grant award. We haven't accepted $13 million from the federal government. This is still a project in the works. So until we have filled the funding gaps, we won't show the project. And
So
we're
for the
working
next
closely with the FRA, the Federal Rail Administration, and the Illinois Commerce Commission, and the Illinois Department of Transportation, and Union Pacific Railroad. Everyone is at the table and talking about whether or not we can get this project funded in the timeline to make it happen within the federal FRA grant guidelines.
So for the next 5 years, you surely have looked into the future. In the next 5 years, where can this money come from? Because we've already got it allocated elsewhere. I mean, why are we working on a project that we can't even identify in the next 5 years we can afford to do if we get the federal grant?
We're working closely with our partners for funding and support. I think
So
we've
there'll
made
be
that clear in the past. We've been talking to Illinois Commerce Commission, the Illinois Department of Transportation, and we're working as a group on trying to get this project to the finish line.
Okay, but it says that we're supposed to fund 35%. That's our match. Where does that money come from? What's the plan?
We're working on the plan, Mr. Nord. We don't have it finalized yet. We're working on that. And it won't be in the budget until we know how it's going to be funded.
All right, well, I don't support this $8 million in the future for staff to come to the council and say, hey, we want to use this $8 million for the underpass because we've already been told it's going to be used to pay off existing debt. So I wanted to get that on the record. And then another question, the COLA was listed in the budget. Is this something that is automatically approved with voting on this budget tonight? Or is this something that at a later point will come up for discussion?
No, it's automatically approved when council adopts the fiscal year 21-22 budget. It will include the cost of living adjustment, which is why it was specifically identified in council's report. Council may recall that last fall, I believe it was in September, perhaps it was either August or September, I brought to you a modification in how we apply a cost of living adjustment to our non-unionized employees. And majority of council supported that change. And at that time, we discussed how you would be notified of what COLA is. And so I mentioned it to all council members in a memo in January. And I put it in the council report, or it was included in the council report tonight. So council would be very clear of what the cost of living adjustment is for those employees we call in the classified system, which means they're not in a collective bargaining unit.
Okay, then I want to get this point out too, since I don't have another chance to bring it up. You had provided the council the number of full-time staff that live in the town of Normal and those that live elsewhere. The town of Normal has the highest taxes in the county. And only, well, 73% of the town staff live somewhere other than Normal, somewhere where the cost of living is less. And if you're looking for the numbers, you had said 359 current employees, 133 reside in Normal. So that 73% live elsewhere in an area that has a lower cost of living than Normal. Yet the Normal residents who pay for this are paying people that are choosing to live in a lower tax area, lower cost of living area. And, you know, we're just exporting at that point. And I disagree with that. If they choose to live somewhere that costs less, you know, then normal taxpayers shouldn't reward them additionally for that.
So, Mr. Nord, we've had many email exchanges about this, and I would love to have a more detailed conversation with you and with council in a public setting about residency. I think it's very interesting for you to bring this up in terms of where employees reside. And so I would love to have that discussion. So I think it's a great topic.
I think that would be fantastic. And if you could bring up the COLA conversation too, because there are businesses that consider where folks actually move to, especially with all the remote workers and things that the remote work that's going on, and they will adjust their cost of living based on where they choose to live as well. So, you know, I do think that it would be nice to talk about this and update things.
Sure.
And just have that conversation. So I welcome that at some point.
Sure, as do I. The other thing I'll mention, though, you commented that Normal has the highest tax rate, and I find that very perplexing. I just grabbed the financial trends report that we share with council every September, and that does not, I guess, indicate that we have the highest tax rate. So if you could share with me your source.
In the county?
Are you talking municipal? What is your source and what are you looking at? So we know how to put that into context.
Well, overall property taxes, Normal assesses the highest property taxes in the county. I mean, I'm not looking for municipalities that are outside of the county. You know, Bloomington would be the next big one. You don't think that? Okay, well.
At least it wasn't last September in our report. So again, I just want to make sure that when we're throwing out facts and statements, I just want to make sure it's accurate so we can respond appropriately. So.
Okay, well, you know, the tax bills are higher in Normal than they are in Bloomington, you know, the overall tax bills. So, you know, it's the overall cost of living. There's also cost of living calculators and places on the internet. So we could see if it costs more to live in Normal than it does, say, Towanda. You know, it's those things, but I'm not comparing with Peoria, Champaign, Decatur, because those are too far.
Just the municipal tax rate and not the community rate. You're just talking about the municipal property tax rate?
I'm talking cost of living. So however the cost of living folks that do these comparisons.
Okay, well, if you could email me your source, if you could email me your source so I just know what it is that we should be looking at, that would be helpful.
Sure, yep. As we get closer to that conversation, remind me and I'll send you some more current information.
Just remind Mr. Nord, she requested that information.
Yeah, that'd be great.
Sure.
Thank you.
Ms. Smith.
Yes, I want to share some observations about the budget after some conversations with town staff, and I'll give references to page numbers for any of the citizens who are following along with this conversation, because I think rather than getting into the weeds, there are some specific pages in the report that I think are useful. On page 91 is a pie chart showing the percentage of expenses by different areas and categories. And the salaries and wages and benefits are at 45%. This is after $1 million cut in staffing expenses that occurred when Bloomington unilaterally canceled the Metro Zone, leaving Bloomington Normal to fill a $1 million shortfall when they decided to stop that contract. And that is why that water line was extending into Normal town limits. And I wonder why it is that someone representing the residents of Normal is so anxious to see Bloomington benefit from development within our town limits should future industrial vendors want to locate there in our backyard, why it would be worthwhile for us to say, sure, go ahead, you serve our water customers and you subsidize your residential customers instead of Normal having the benefit of that. And also in a conversation with a former council member from Bloomington, it was pointed out to me that when he left the council around 2016, that he was aware that there was an issue with capacity in Bloomington's water service, and that should additional water service be required on the west side of Normal, absent Bloomington developing some new wells, which they recently did, that would be beyond their ability to service those customers. So if Normal wants to be in a position to benefit the residents of Normal, I think it behooves us to be prepared to encourage development coming to that area. But coming back to the expense report, those salaries and benefits at 45% are down 3% from an earlier year. I'm more accustomed to seeing service industry have salaries and benefits represent 50% of a business's expenses. So I believe that the town of Normal is being responsible with making cuts in an area that provides long-term relief. And this is even after this budget incorporates the fact that minimum wage is creeping up to $15 an hour, and those salary and benefits are reflecting those higher payments to individuals at those entry levels. And if you'll notice, the expenditures are 115.6 million, but if you turn to page 53 in that pie chart of revenues, you'll see that it's 114.1 million in revenues. So there is a shortfall. So that effort to set aside dollars from this year to help offset that operating budget that is coming about because of the shortfalls we've witnessed this year in COVID are being provided for with some forward-thinking planning to say, we've survived this fiscal year, but next year is a challenge. Let's take care of that with some transfers that occur on the balance sheet, not on the income statement. So you're not going to see it reflected in this budget to help make sure that we're able to provide for this. And I was provided assurance that this budget does include an allocation of $8 million going to retire debt early when it becomes callable. Now, a thing that is at risk in the legislature, in a previous session, when the state of Illinois was facing budget shortfalls, they had a situation where the state cut back on what it shared with municipalities. This budget doesn't allow for that. It doesn't include that. So we could easily be facing more pain if the state of Illinois decides to adopt that measure. So for all of the talk of we need to have better priorities, the question is, where are you going to get the money from and what are you going to cut? Because when staff came to council to say, can you recommend some cuts? There was general consensus. We don't want to cut services to residents. That would be something that would be noticed. It would be painful. It would be problematic. So the staff made cuts, taking people out of jobs, cutting back on how it's delivered, trying to be more efficient. So I want to get that out there to make sure that if you're trying to get the big picture, the pie chart on page 53 for revenues and 91 for expenses is worthwhile to see. Also, there's another page that has where the demographics are. So when we're talking about the statistics and road miles and pipelines and miles of sewer lines, that demographic page is in the back of the report on page 383. That helps put into context just how complex it can be for the town of Normal to deliver services to its residents when it includes so much infrastructure. So again, anyone looking through this report, I want to call your attention to that demographic page. And finally, I don't have this page number memorized, so I'm going to have to call upon Mr. Yoon. There is a page that provides a summary of what the bonds, the outstanding bonds, what they paid for. And when I'm finished, if Mr. Yoon wants to provide that to anyone reading this, for the most part, the town of Normal invested in parking garages, It invested in the new City Hall and Transportation Center. It invested in this Children's Discovery Museum. It invested in the Conference Center. This is where the dollars went for the debt that is now standing at around, is it 81 million? Yes. So this is what we have to show for the borrowing we made. And not all of that was from Town of Normal taxpayers. And it did go far to increase the property values in the surrounding areas. And if Mr. Yoon, if you would provide that information on that page with the bonds, I'm done because it's late.
It's actually on page 251.
Thank you. And that's all I have.
Mr. McCarthy.
Thanks, Mayor. There's a lot of good things that we can talk about in this budget. You know, the conversation so far is focused on a few things. And just again, as you hear me say this a lot, I like to level set our conversation and focus it back on our task at hand and with information we know to be true and accurate. So as far as the water main potential project out to the Rivian area, we've heard this before, and every member of this council has been made aware that there's current conversations ongoing that will need shovel-ready sites, and that means town infrastructures. And we've been told that this is coming up, and we have companies that are here currently looking at locating near the plant, and of course they will need infrastructure. So if a specific company asks for a specific water main, of course not. That it doesn't work that way. How it works is that companies look at a location and is there a shovel-ready site that has infrastructure or has commitment from community to look at it and invest in infrastructure if they make the decision to be there. And that's what we're talking about. So we're talking about being prepared in that situation. And if those projects materialize, and then we'll build a water main. So just to level set on that. Also, I think it's really important to kind of put everything back into context because it keeps getting removed out of context. So let me help to put this thing back into context, is that to defray the future costs of our water treatment facility and water system, we add customers to the system, assuming we have capacity, and we have a lot. And so by adding customers, we help lower the future cost of maintaining our water facility, our water treatment facility and system to our existing normal residents. So planning and being prepared for economic development is in essence helping to defray future costs for our normal residents. There was a comment about using debt funds for the underpass. I just want to reassure the public that Mr. Nord is the only one that's talking about this. I'd just like to reassure our citizens. I think I'm safe in saying this. Any council member, please disagree with me if I'm wrong. But I think I'm safe in saying that nobody else on this council is considering using debt set aside money for an underpass project. So let's just level set and be clear that that's not on anybody's radar here. I also wanted to mention, Ms. Smith ticked off a couple of things that I had on my list, but I just want to remind everybody that in our upcoming budget, one of the highlights that we get asked about a lot, and some citizens are very focused on that, but in this upcoming budget, we're looking at almost a 50% increase in roadway investments coming up, and that's really positive. And just make sure that gets out there for those that are concerned about that and focused on that. We hear you, and we're responding, and we're putting more money towards it. I'm supportive. Thank you.
Ms. Lorenz.
Okay, yeah, I wanted to highlight some of the things that I'm pretty proud of. I mean, speaking of water, as you guys know, for a number of years, I often advocated for us to freeze the pay or the rate increase on water. We are not increasing water rates in this budget. If I saw that correctly, Mr. Hune, give me a yes. Okay, so I saw that adjustment was made. So thank you very much. I think that is a nice respite for us to be able to give to our water customers. But to Mr. McCarthy's point, we got to keep looking ahead and ways that we can create economies of scale to keep the costs down, and looking for ways to expand our water system is one of those ways. And so point well made, Mr. McCarthy. You know, another point that I was going to make too is that we are, in fact, spending more on roads this year than last. And so that is not to be lost either. So many details in this budget. You know, it has been a difficult year. And, you know, with the pandemic that we have endured for the last year, we don't know how we're going to come out of it. But all things said, I think I would like to applaud the expert forecasting and estimating that's gone on over the past year by our finance team and the administration, and keeping us apprised of that, so that we have a clear picture of what the next 5 years can hopefully look like. So I support this budget. Thank you.
Mr. Nord.
Thank you. With the money that's being spent on the roads, is any of that money going to be spent on bike trail?
Well, I can take a quick look. I don't know if Mr. Hune has it off the top of his head, but we do have a commitment in the capital fund for our Route 66 trail. That's a commitment that we cost share with the county for some trail extension. I think we also have a grant project, a project for a trail extension that has some grant funds allocated to it. And that's also along Route 66 to the Kelly Detention Basin. I believe that's in the proposed budget as well. That would be in the capital fund. Those are the only two that come to mind.
Along Gregory Street?
Well, I'm not sure.
College Avenue?
Well, College Avenue hasn't been designed, so we just talked about that. But the Gregory Street one, we asked council to authorize a grant application last summer. I'm not sure if that is included in our MFT program or not. Maybe Mr. Otto can remember.
Yeah, thank you, Mr. East. No, the Gregory Street project is not included in this budget.
Okay. And some of the funding then for College Avenues in this budget, right?
Are we talking about West College Avenue that we just talked about in the previous agenda item?
Yes, West College Avenue.
Our design funds, our design dollars are allocated, yes, to motor fuel tax.
Yes. And some of those funds then are being used to design trail as well, and will go towards trails. So I just don't want it to be lost that all the money is going into roads that cars and trucks drive on, motorized vehicles
we
drive on. It goes into other things as well.
Transportation.
Yes. And transportation could be sidewalks as well. Yeah, like the 200 and some odd $1,000 down Landmark Drive.
And the 583,000
well.
council just, yeah, right, Mr. Nordic, and the $583,000 that council just approved earlier this evening.
Yeah, and there's been quite a bit of talk about extending this water out towards Rivian. Some folks have said that the council is aware of projects coming up. I want the public and other council members to be aware the entire council does not know of these things that you're saying that are in the pipeline. I have no idea. I've been told there is nothing. There's been no request from a business. So, you know, this is not common knowledge shared with the council if there is something coming. If there is something coming, then, you know, my stance would be possibly different, because then I would know what it is. But not being in the know, I just have to assume that this is speculative. We're hoping for something. And when I look at any spending we do, I'm not looking at it as, hey, is this going to just benefit Normal? You know, if we're going to do something to benefit Normal at the expense of Bloomington, you know, Bloomington already has service to that area and south of College Avenue. Normal has got service, all kinds of service north of the Rivian plant. The only place that does not currently have water service out there would be on the west side of Rivian Motorway. And there's been no talk of boring under there, because the town of Normal could bore under there from the north, and you know, Bloomington could bore under there from the south if they needed water on that side. So unless there's development coming somewhere else, you know, I'm just not privy to that conversation. And again, when I look at this, I'm not going to make a decision that benefits Normal at the expense of Bloomington. I look at my decisions based on what's best for the entire community. And if we're simply building something to compete with Bloomington, then, you know, I'm just going to be disagreeable with that, because I've got lots of friends, family, and, you know, I may end up moving to Bloomington, well, returning to Bloomington at some point in my life. And we should not be competing with our neighbor. We should always be collaborating. And I will always push back if it looks like we're doing something to compete with them. And I hope that they would, or that council members over there would think of the entire community when they make their decisions as well.
Understood, Mr. Nord. Thank you for that. I just wanted to point out that, you know, we're, in terms of the entire $130 million budget, we're spending a lot of time talking about a water project that is budgeted, that we haven't designed, that we haven't gone out for bid for, and we haven't asked council to actually approve a contract. So, you know, it's currently under design, hasn't been designed. It's actually currently being studied. We have authorized that expense, but trust me, before we get to the point of asking council to authorize spending millions of dollars, $4.7 million per our budget, it's coming back to you to say yay or nay. So I certainly hear what you're saying. We've made the case regarding the value to looping the water main, but that's one project out of $130 million budget, and it will come back to you if you want to approve it or not approve it in terms of that specific water project. The rest of the budget, I mean, the entire budget, I'm very proud of. I think the finance department did an amazing job, as did every department in this organization, to put together a financial spending, revenue, and expense plan that we can frankly be very proud of, and that I know is very solid. It's conservative revenue estimates and pretty realistic expense estimates. And as is always our case, we try to underestimate revenue and overestimate expenses, because we just don't want to be surprised. And I think that's what council will find in this budget document for fiscal year 21-22.
The budget is a plan, and the way that I see this is if you're not planning on spending the money, don't have it in there, because the perception that I have is we're now giving up projects where neighborhoods have got failing water pipes that are corroding, and we've got rust going through there, just like the mayor's neighborhood, that we are delaying addressing simply because this is in there. And if we don't have the intention of spending it, don't put it in there. You can always ask for more money, but we're essentially telling the public that this speculative thing is more important than addressing current known issues with our water system. So I respect that it's going to come back before us, and hopefully I will be told more information as to why I should support it, rather than we want to do this because we think there's something coming.
Mr. Nord, let's be quite clear. I do not have rusty water in my neighborhood. I do not have it, period. You keep bringing that up. It is not true. Mr. McCarthy.
Thanks, Mayor. I'm surprised to hear Council Member Nord not knowing about that there's economic development interest, particularly when he shared at a meeting that he had met with the director of the EDC. I'm shocked to hear that that conversation didn't happen when he's expressed in public meeting that he's talked directly with Mr. Hoven at the EDC. I certainly know that we've had this discussion on a number of council meetings before, that there are active conversations going on with the EDC for potential projects out there. Of course, nothing's signed or penned yet, but there's active, highly interested parties. As far as Bloomington serving water in the town of Normal, I guess, you know, again, putting this whole thing back into context, you know, I was elected in Normal to look out for Normal residents. You know, as of today, we are separate communities, separate bodies, separate water systems that cost real money. Taxpayers have to write real checks to pay for our water system. You know, while that's true, I'm going to continue to look out for the best interests of the residents of Normal. I'm not interested in using our economic development projects in Normal to subsidize the water system in Bloomington and to help out Bloomington. I'm interested in subsidizing the water system in the town of Normal to help defray the cost of our water system for the residents in Normal. I'm interested in protecting them. And while we have separate communities with separate elected bodies with separate water systems, I'm going to do what I believe is in the best interest to help and support our taxpayers and not subsidize Bloomington. As far as the either or conversation, it's not an either or conversation. I believe, if I'm not mistaken, that we've got an active project to address the water main to the one neighborhood where we're having some problem with. Is that an accurate statement?
It is accurate. We are soon going to be going out for bid, and council will be, we should have a bid recommendation and a contractor recommendation, I believe, in a month, maybe 2 or 3 meetings.
So to level set for the citizens that are watching, you know, we look across the entire community again in context, and we do lots of projects across the community. We don't do just one project at a time. And so we have the capability and the capacity to do multiple projects across. And the one most pressing one is getting addressed. And as you just heard from Ms. Reese, will be coming back to us soon for funding and response. Again, I'm excited about this budget. There's a lot of good things. Ms. Smith talked about some, Ms. Lorenz talked about some, I talked about some. I think it's a responsible budget. We're in really good shape. And I too want to lend a thank you to Mr. Kuhn and his team and all of our department heads for their diligent work on putting a fine tooth comb and a fine point to their pencils to bring us a budget that is balanced and lives within our means. I'm happy and excited to support it. Thank you.
I'm going to riff on that a little bit, Mr. McCarthy, and say that, you know, in the last 4 or 5 years, a couple of times, the world has thrown us some curves and some tough issues. And year in, year out, the staff of the town of Normal figures out ways to do the best they possibly can to have the least negative impact on our citizens in terms of delivering high quality services day in and day out. And so I think it's an appropriate point, again, to say thank you to all the department heads, Ms. Reese, to you, and really to all the employees of the town of Normal, because the budgeting process touches them and they're part of the budgeting process. And they care deeply about the community that they work for. They're very professional at what they do. And it's reflected in the budget, and it's reflected in the work that they do day to day. So thank you.
Thank you for those comments.
Please call the roll.
Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
No.
Mayor Kus.
Aye. The ordinance is approved. Item 8 is a resolution approving a lead service line replacement program.
I
So
move this
approval.
item.
Second.
Thank you. Is there discussion on this item?
Mayor Kus, if I could just jump in and ask, I'll do an introduction and ask Mr. Burkhart to join in the conversation by, there he is, turning on his camera in case council has any questions of him. This particular agenda item, sort of last but not least on your council agenda this evening, is a follow-up of a program that we introduced during the budget work session in January. We believe this is a rather creative and unique a way to partner with our residents that, and frankly, in the grand scheme of the number of utility customers we have, there are very few that are impacted by lead service lines. But we think this is one program that we can try to partner with those residents to see if there's a way to work with them to get those lead service lines replaced. And frankly, we'll see how it works out. If we find that it is not working quite as well as we'd hoped, or that there needs to be some tweaking, we will come back to council and ask for a modification if necessary. But based on some initial information we have about typical cost of replacing service lines, we think this is a pretty good start. And this is, again, I think a unique program, and Mr. Burkhart deserves all the credit for coming up with this program. And so if you have any specific questions about it, he's prepared to respond.
I think Mr. Burkhart did a pretty good job of explaining the program recently. And again, you're right, this is an innovative program, and hopefully we'll get the problem solved. Ms. Lorenz.
Okay, I heard from a resident, and basically, I think it would probably be best for this person to, and maybe there'll be others like her that might have some questions. Who can residents call if they feel like they're confused? Maybe the information that maybe has come to them via like door hangers, maybe they've got some questions. What can they expect in terms of future communications? So these are probably a lot of one-off questions that might be best dealt on an individual basis. Is there a way that these residents who are most affected can have a number to call or an email to reach? What would be their best course?
I'll ask Mr. Burkhart to respond in a moment. If following council approval of this, we will be marketing the program.
Okay.
And Mr. Burkhart can talk about how individuals who might be eligible for this can get more information or get questions answered.
That would be great. Yeah.
Yeah, so we plan on reaching out to all of the known residents that have a lead line, most likely a letter, and then we'll follow up that letter with a phone call if we've got good contact information for them. See if they've got questions, concerns, their thoughts on it, if there's something that they want to participate in, if they're not interested in participating, if it's something they think they can handle on their own without, having the town pay for it and repay us back. Just kind of see their thought process of this.
Okay, good. I will let this person know that.
Mr. McCarthy.
Yeah, I just had a quick question. I was talking to a resident about that, and they know somebody who has this. And although I think I know the answer they asked me, is anybody with a lead line eligible for the program? And I said, I believe so, but I'm assuming that answer is yes.
Yes.
Great, thanks.
Mr. Nord.
Thank you. So it says that all the known lead lines on the town side should be replaced by 2022, which I guess is only giving us, what, 9 months? Why is it should versus it will? I mean, is there a high probability that they're all going to be replaced, at least the known, or are there some potential issues that this may not get addressed this year?
The only issues where the town may not be able to replace their portion of the lead line is where the homeowner also has lead line on their side. The EPA does not allow a partial lead line replacement. So for the town to replace their portion, the homeowner has to replace their portion at the same time. If the homeowner refuses to replace their lead line, the town cannot replace theirs.
Okay, so, okay, well, that clarifies that then. And then hopefully then we can do something so a future homeowner would know that there's possible lead exposure to their water, and you know, hopefully that can get taken care of at a sale. Just like, you know, lead paint, you know, that's the disclosure time. All right, well, I'm very happy that this is finally coming to an end. Since I learned that the town knew of lead lines, I've been kind of an advocate to get this sped up. So thank you very much for all the work you did that I don't know anything about to be able to get this on the agenda tonight, because I know it's sooner than what it was originally planned to get done. So I do appreciate that.
You're welcome. Thank you.
Please call the roll.
Mrs. Lorenz,
Aye.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
Aye.
Ms. Smith,
Aye.
Mayor Kus.
Aye. The resolution is approved. That concludes our business tonight. We have no public commenters. So before taking a motion for adjournment, are there concerns? Seeing none, motion for adjournment, please.
Move to adjourn.
Second.
Please call the roll.
Mr. Preston,
Aye.
Mr. McCarthy,
Aye.
Ms. Cummings,
Aye.
Mr. Nord,
Aye.
Ms. Smith,
Aye.
Mrs. Lorenz,
Aye.
Mayor Kus.
Aye. We are adjourned. Thank you.